about what's happening to our own families, what's happening in our own lives. Have we been exposed to this virus or not? Are we still vulnerable? These are the questions that people want answered and want to know what it means for their own safety and everyone they love. And we know the question has always been from the very beginning. This goes back to when we first talked about COVID-19 back in January. The question has always been testing, testing, testing. How are we going to get the testing? How are we going to be able to get answers? Even with this difficult adversary, this mysterious adversary, how do we at least get less mystery about our own lives and get answers through testing? So testing is the way forward. And it's been a long fight just to get the testing we need, the ability to give the tests. But today we have good news. Today we are beginning to see an easier process for testing. And I'm going to talk about it by putting it in context of what I experienced Saturday in the Bronx at the Health and Hospitals Gotham Community Testing Center in Morrisania. I went up there to see how the testing was being done, to see how our extraordinary healthcare workers at the front line are giving people answers, helping them get clarity, figuring out with them what they're going to do next based on the results of the test, making a lot more testing available in the places hit the hardest, like the South Bronx. So we all know that a few weeks ago we were just trying to save our hospitals, save lives. We couldn't put together the personnel and the PPEs and the test kits and all to do community testing, but now we were able to over this last week or more. And so as of this morning, there will be 8 health and hospitals community testing sites around the city, open for business. And since we started this initiative a couple of weeks ago, even less than a couple of weeks ago, there have been now over 5,000 tests at the H&H sites, another more than 2,600 tests at the sites we've sponsored with Local 1199 SEIU, the Healthcare Workers Union, and One Medical. That number is substantial, but now we're going to be taking it up. It'll be 10,000 tests per week or more at these community-based sites, and we want to keep ramping that up. But the challenge has been, and I saw this with my own eyes on Saturday, that the test process we've known up to now, the test kits that were used, which had a specific long swab and it required a trained medical professional to administer the test, not fun and easy. Very long swab, had to go way up into someone's nose, had to be handled a certain way, kept in a certain environment to be sent on to the lab. This was a more elaborate process, and not only slower, more elaborate for the patient, but for the healthcare worker, a challenge in many ways. And our healthcare workers have gone through so much already. But realize, even in the testing process, how much they had to do. A healthcare worker, even to do one test, had to put on, if you will, their body armor. They had to put on the whole PPE ensemble, the face shield, the N95, or whatever type of mask was appropriate, the gloves, gown, a whole specific plan to keep them safe. Because the problem was, with the tests we've been using up to now, a lot of times it made the patient sneeze. And obviously it might be someone with COVID-19, and that was going to expose the healthcare worker. So it was a laborious, careful process. But of course, a process done with someone who might be infected with a disease that might therefore infect the healthcare worker, so we had to take real precautions. And that was every single patient, every single person being tested, hour after hour, day after day. And it was a slow process, and a process that came with real exposure for the healthcare workers who've been through so much. We have been working to confirm for weeks now that there was a better way to do this. And the good news I have today is there is a better way. There is a better way to do testing. There is an easier way to do testing. And there is a safer way to do testing. And we're going to start that this week at our health and hospitals clinics right here in New York City. So we're calling it, just to make it simple, straightforward, self-swab tests. What does it mean? It means when you go to one of the community testing sites, instead of the healthcare worker having to be all prepared with all the PPEs and then take that very long swab and administer the test. No, this is a whole different thing. This means the healthcare worker explains to the person there for the test how to administer the test themselves. They go into another room for privacy, and the patient takes something that's basically a sterile Q-tip, puts that in their nose. They don't have to go way deep, just enough to get a sample. They, forgive my bluntness, they spit into a cup, and those two samples provide enough information for the testing to be done. Much simpler, much easier for everyone involved. No chance to cause the same kind of sneezing that long swab way up the nose does. Simpler, but also safer, especially for that healthcare worker, so many of whom have been putting their lives on the line now for weeks and weeks. So when that's done, just like we've all experienced, many of us at least at doctor's offices, you hand a sample over to a doctor, a nurse, a healthcare worker, you do the same here. The clinic or the healthcare provider sends it off to the lab to get the results. Now, this is simpler, this is better. This is something we're going to start using now aggressively because it'll improve the situation for everyone. We need partnership from the private labs that do the processing. We're engaged in these conversations with them already. We need them to step up. What our healthcare leadership here in New York City have told us is it's a very similar process to what they would do with the current samples. It doesn't take a lot of modification, but we need the private labs to agree immediately to do this on a wide scale. We have enough to get started, but we want to make sure we do this on a wide scale. So I'm asking the private labs step up, make the small alterations necessary to be able to take these simpler tests, and I think that will be a step forward for everyone. For healthcare workers, this will be a simpler, better reality. Also think about the PPEs that will now be saved in this process. They've been precious up to now, that personal protective equipment. We know it's been a fight week after week to make sure we had enough. This will mean we'll be able to conserve our supply a lot more and make sure we have it for everyone who needs it when they need it. So there's a lot of virtues here. It will also just take fewer healthcare workers to administer this kind of test because we'll get more done in the time we have. So it helps on so many levels and allows more healthcare workers to be at the front line where they're still needed so deeply. Now, it's faster, as I said. Right now at an H&H site, because you have to process each individual and explain what's going to happen and administer the test, and everything has to be done very methodically, they can do about 15 tests per hour for each healthcare worker taking the tests. But 15, I shouldn't say per person, per site, 15 tests per hour. With this new approach, that will go up immediately to 20 tests per hour, and then we'll keep expanding from there. Again, we need help. The private labs, we need them to really get with this new approach quickly, help move it forward, because this will make everyone's lives easier and faster, and this will give more people answers, and it will simplify and clarify our steps forward as we move into that test and trace period in the month of May. But we also still need the federal government. I don't want anyone for a moment to think this means the federal government doesn't have responsibility. They still do. And the big question now, and again, testing has been the big Achilles heel of the federal government from the beginning, but here's a chance to get it right. Use all the tools of the federal government to expand lab capacity so we can help New Yorkers, and this is needed all over the country. We need the supplies that go to those labs to make them work, particularly what's called reagents, which are part of the process of doing the actual analysis of each sample. There is still a crisis of supply affecting the labs. We still don't see the federal government owning this problem to the extent they need to. It's been the same story from the beginning, not focusing on testing when we needed them to, and then even when everyone became clear that testing was the answer, we don't see the federal government using all its powers, all its tools to secure the supply chain, to make sure the test kits originally and the lab capacity is there. That needs to be fixed immediately so we can take a big step forward in May. Now remember, the more tests you do, the faster you move towards low-level transmission of this disease. It all starts to come together. Expand testing rapidly, more and more of the contact tracing, more and more getting people to isolation who need it. That's what May is going to look like. But this is actually going to help us speed that up markedly to be able to do a simpler kind of test. One day, and I think it is possible, we'll be able to test everyone we need to. Again, we cannot do it without federal help. But one day, if we do this right, we'll be able to reach everyone we need to on any given day. And you'll see an extraordinary correlation of how every step towards that day connects with pushing back this disease. I'm not saying it's going to be perfect. I'm not saying it's always going to go in a perfect straight line. You've seen with our indicators, and we'll get to them in a minute, things go up, things go down. Sometimes we'll have setbacks. That's part of life. But so far, New Yorkers have done an extraordinary job pushing back this disease, and now the testing is starting to come into play. If we do it right, it may not be a perfect straight line, but it will be regular, consistent progress. The more testing, the more progress. This will help us achieve more testing. It's simple as that. So, of course, once you have the testing more and more widespread, you need that ability to trace the contacts of everyone who tests positive. And as we've talked about before, when we were tragically seeing the disease spread and spread and spread, we weren't able to do the contact tracing. We were trying to save lives, protect hospitals, deal with the most basic needs of people, but we couldn't build a whole contact tracing network that we wanted for something of this size. Now, the good news is we can. And that's what we're going to build in the month of May. A contact tracing network in this city like's never been seen before on a vast scale. So every time someone tests positive, immediately we can swing into action, figure out who were their close contacts, get those people tested to isolate anyone who needs isolation. So I'm announcing today that we are hiring. We are looking for talented, experienced health workers. So anyone out there listening to me now, watching this, or anyone who hears about this, if you have experience in the healthcare field, if you're ready to lend your talents this fight, we need you, and we need you right away. We are hiring immediately, and we'll be hiring throughout the month of May. City of New York plans to hire 1,000 contact tracers immediately. They will be working with all the healthcare personnel we have already, and people we will train from a variety of city agencies to complement this work as well. But right now, we need 1,000 new contact tracers. We're getting great help from our Fund for Public Health, and I want to thank everyone at the Fund for Public Health for the great work you do, and all the people who support you and have donated to the Fund for Public Health. You're going to see that support come alive in a powerful way now as we fight back this disease here in the epicenter. But we want to get the word out to everyone that we need to hire up right away as this work begins. What will they do? The contact tracers, literally, they'll do the interviews to determine who were those key contacts. They'll follow up with those contacts. They'll arrange for each of them to be tested. Folks who need isolation, they'll make sure they're getting it. They'll help make sure that the steps that are needed are glued together. And they'll ask the questions that are needed, and that training will be so important to understand if there's anyone who needs that follow-up. Talked about disease detectives before. This is a variation on that, but it's the same concept of knowing how to ask the right questions, knowing how to search for the clues of the people in someone's life who tested positive that need to be contacted, need to be followed up on, need to be tested. So again, we'll start immediately, and anyone interested should go to the Fund for Public Health website. It's fphnyc.org. Again, fphnyc.org. Very, very important, please. We need you to come forward right away so we can get you into this battle and help save lives here in this city. Let me switch to a couple of other important topics before I talk about the daily indicators. First of all, something so many New Yorkers ask about and care about, and it's important to everyday life, alternate side parking. Alternate side parking, in this crisis, we've seen something very unusual. There have been so many fewer people out, and obviously businesses closed, et cetera, that the reality why we need alternate side parking to begin with has been altered fundamentally. So we've been watching regularly. Our sanitation department is monitoring communities to make sure we don't want to see communities get dirty. We don't want to see anything that would undermine the hygiene of this city in the middle of a pandemic. Been very pleased by what we're seeing. Streets are staying generally clean. I know a lot of everyday New Yorkers are helping to make that happen. I thank you for that. So as we continue to see progress, we can continue to pull back on alternate side parking. We've been doing it 2 weeks at a time. We're going to keep doing that for the foreseeable future, and we're going to judge each time what makes sense. But I am here to announce that we will suspend alternate side parking for the next 2 weeks, and that will take us to Tuesday, May 12th. Again, as we get close to that point, we'll have another update. Very important update I want to give now, and it's something that's been worked on for the last few days. The weather has been getting warmer slowly but surely. We've talked about the changes that when it gets warmer, there'll be more and more people outside. Gotten a lot of good questions from everyday New Yorkers and from the media and from elected officials. How are we going to balance this? Well, we're going to have a bigger plan for the truly warm weather in summer, but in the here and now, we can predict in the next few weeks, as we go through May, it will get warmer and warmer, more people out, more challenges. A lot of folks have asked good questions about what can we do differently. And I've said consistently we want to see if there's new approaches, but we have to make sure they're safe and we have to make sure there can be enforcement. City Council came forward, I think it was Wednesday, with a vision of how we could come up with a plan to open up more streets, do it over time, and do it in a way that was responsive to the core concerns we've heard from the NYPD, for example, about safety and enforcement. We've been engaging the City Council over the last few days with a very positive spirit because, as I said a few days ago, when you look at the history of the relationship between both sides of City Hall, we always come together in the end and find a solution. There's been a collegial, positive spirit always, but particularly during this pandemic. And we share a lot of the same values. So the City Council's been absolutely right to say, let's keep looking for solutions here. And I want to thank them for that. I think it's been right to say, let's find a solution that helps open up space, but absolutely keeps people safe, because the first job here is to protect people's safety. So I want to announce today that we have reached an agreement with Speaker Johnson and the City Council. And over the next month, we will create a minimum of 40 miles of open streets. And then the goal during the duration of the COVID crisis, and we don't know how long that is, obviously, but as this crisis continues, we're going to all work hard to keep it as short as possible. But during this crisis, the goal is to get up to 100 miles of those open streets. And the way we will do it, we're going to focus first on streets in and around our parks. Very concerned about the streets on the outside of parks that oftentimes we're seeing that immediate area getting very crowded. That's an obvious opportunity. Those streets adjacent to parks are an obvious opportunity to open up more space. So we're going to work together to figure out how to do that. Some places we'll be able to expand sidewalks. Use the example of what we did over the holidays around Rockefeller Center, where you just open up the sidewalk space into the street more, but with the proper kind of barricades. Some streets will be more local areas that aren't necessarily where you have a major attraction like a park, but they are places where we can safely open up some space and have it be enforced. And another important piece of this discussion is early action bike lanes, where we see an opportunity to do more with bike lanes. Done some of that already in this crisis. We want to do more. So the focus here will be to focus, of course, same as we're doing with so many other things, where the need is greatest. So many communities that we already have identified have been very hard hit by COVID. Want to be particularly sensitive to implementing these kind of steps, working with the City Council, working with the Police Department, Transportation Department, Sanitation Department, Parks Department, figuring out all the right places we can do this. But first priority on the places hardest hit. And then, of course, figuring out where they'll have the biggest impact, where the most people are. So that's good news from the good work we've all been doing together with the council over the last few days. Now, let me go into the indicators for the day. And I think today's indicators are broadly good. It's not the perfect thing we want, all down in the same direction, but broadly good. And we keep making progress in one form or another. I want to see more, and I want to see steadier progress for us to really be able to make some of the bigger moves we all would like to make. So the first indicator today, daily number of people admitted to hospitals for suspected COVID-19. This is obviously the root of everything. This one's down meaningfully from 144 to 122. That's very good. The daily number of people in ICUs across our health and hospitals, public hospitals for suspected COVID-19, that's down, but only a little, 768 to 766. Percentage of people who tested positive for COVID-19 citywide, stable. Not going in the wrong direction at least, but stable at 29%. The one place that was not so good, the public health lab tests, went up 46% to 55%. That is, again, an important measure, but it's a measure of a smaller group of people. When you composite the day, progress, but not enough progress, but it's a reminder, everything we're doing is affecting these indicators. Let's keep doing it. So, as I conclude, and I'll say a few words in Spanish, but first say, look, the test and trace plan we talked about a few days ago, this is really the key. It's going to be very aggressive. It's going to be large scale. This is how we take the good work that all of you have done, we supercharge it by finally getting testing on a wide scale, tracing people, isolating everyone who needs it. Doing that is the path forward. But we knew the testing piece of the equation was a challenge because we've always struggled to have the testing capacity we needed from the very beginning of this crisis. Finally, we see something simpler, having an approach to testing that will protect our healthcare workers more, save time, allow a simpler process, a process that's easier for the person being tested as well as for the healthcare worker. And the fact that it will speed things up and require less personnel over time is a huge, huge benefit. So the goal here is to test as many people as possible. This is another step toward that. It's a good way to start the week with some good news, and it makes us even more ready to go into May with that aggressive test and trace strategy that I think is going to be a game changer for New York City. Just a few words in Spanish. Nuestros trabajadores de salud están haciendo un trabajo heroico en nuestros centros de prueba. Y les debemos cada forma de protección posible. Con el autoexamen les daremos alivio y vamos a seguir ampliando la capacidad de hacer pruebas para más neoyorquinos. Cada día estamos poniendo más piezas en lugar para lo que viene. Y mi promesa a los neoyorquinos es que vamos a estar preparados. With that, we will turn to questions from our colleagues in the media. And as usual, tell me the name and the outlet of the journalists calling in.
We'll now begin our Q&A. As a reminder, we have Dr. Daskalakis, Dr. Barbeau, Dr. Katz, and Senior Advisor Jay Varma, all also on the line. First question today goes to Bridget from WNYC.
Good morning, Mr. Mayor. I have some questions related to the election. Tomorrow would have been the presidential primary here in New York. So just a few questions. First, the governor announced in an executive order last week that the state board elections wants municipalities to mail absentee ballot applications to all voters. Just interested in your reaction to that, along with keeping poll sites open. Do you have any concerns there? He also canceled the special elections for Queensborough president. and city council, and I'm wondering your thoughts on that. And then finally, the State Board of Elections is meeting today and may cancel the presidential primary here in New York. Given that you were a supporter of Senator Sanders, I'm wondering about your thoughts on that.
Thank you, Bridget. I think the absentee ballot approach is very much a step in the right direction. And look, Bridget, you've been very, very deeply involved reporting on these issues for years now. This state was way behind the country for a long time. Last year, we saw extraordinary reforms and change. It was a moment a lot of us have been waiting for decades, where New York State finally caught up with the rest of America in terms of a lot of crucial reforms to make voting easier and to protect the voting process. In this crisis, to me, the first question is health and safety. Care deeply about the sanctity of our elections, but the first question is health and safety. So I think the absentee ballot approach is the smart way to go. And in fact, it's teaching us for the future if mail-in ballots might be part of yet another piece of a strategy, which some states use very widely already, not just because of this crisis, to make it easier for people to vote and encourage more people to vote. So I'm very happy that approach is being used here. I think we could go a lot farther with that potentially. I think the absentee approach is what everyone should do. So my advice to everyone involved is let's just focus on folks mailing in. It's the safest approach. It's so long as it's being made widely available and it will be handled benevolently, meaning, for years and years, there was kind of a burden of proof on the voter. If my assumption and my hope here is that every absentee ballot application will be regarded as automatically valid. In that case, that's the way to go. That's where the energy should be focused on. Certainly don't want to see people out and about who don't have to be. On the other issues, honestly, compared to all the other concerns out there, none of this registers to me as something I'm particularly worried about. Respect the decisions that the state has made. I was a proud supporter of Senator Sanders. He obviously made the decision to leave the race and support Vice President Biden. I think that matter is closed. So I think keeping the election activity to a minimum in this environment makes sense. What I'm looking forward to is getting through this recovery the right way and getting our whole society back to normal and having elections again as an indicator of our renaissance, of our resurgence. But I think that's something that obviously is going to happen in the fall, not now.
Next question goes to Andrew from WNBC.
Mayor, how are you? Good morning.
Hey, Andrew, how you doing?
Good. I was wondering if you had seen some of the studies which show that outdoor transmission of this virus is extremely low. And as a result of that, are you considering assisting restaurants by closing some of the streets like 9th Avenue to, when they ultimately reopen, essentially create sort of the maximum amount of outdoor restaurant space in New York City? Have you begun discussions on that, and do you think it can happen?
Yeah, Andrew, I think that's a very interesting idea. As we've thought about, and we have begun discussions, but as I say, when we have firm plans, step by step, we'll unveil them. But there's something elegant about that solution. We know that when the right time comes for restaurants to reopen, there's still going to be real questions about how much distancing, how you protect customers, how you protect the folks who work in the restaurant. And clearly there could be advantages to having more of it be outdoors. You still have to have those precautions thought through and acted on. But there's something appealing about shifting more of the activity outdoors and adjusting accordingly, obviously in terms of how we handle streets and sidewalks. So there's something very, very interesting there. Now, I have not read that particular study, to be fair, and I think one of the things we can say about COVID-19 is we get new information all the time and a lot of unknowns. But I'm very intrigued by that idea, and I want to see if it's something we can act on as we think about that piece of the reopening. I don't know if any of the doctors wants to comment further. Doctors, anyone?
Sir, I'll just add that my team and I actually have begun those conversations to talk about ways in which we can provide clear guidance to New Yorkers with regards to maintaining distance while we are able to lift early the some of the layers of social distancing, and certainly maximizing our use of outdoor space is one of those potential options, especially when it comes to restaurants.
Okay.
Next question is Jen Peltz from the AP.
Hi, Mr. Mayor. How are you?
Good, Jen. How you doing?
Fine, thanks. I had just some questions a little bit about the self-swab testing that you mentioned earlier. One was, could you explain a little bit further about why there are two samples being collected here, one nasally and one from saliva? And also a little bit more about how come this reduces the need for personal protective equipment.
I'm going to start as the layman here and then pass to the doctors. So Jen, so it is two samples, two different samples from the same human at the same time, and that actually is helpful in terms of cross-checking and helping with ensuring the validity of the outcome of the test. But the other thing is just to try and, I'll try and be clear without being overly graphic. So why is it safer? Because so when I was there at Morrisania in the Bronx, they took out the actual test kit, and here's the swab. And the swab, I don't know, I can get the exact length. One of the doctors probably knows exact, but it's a long swab. It's not think about a Q-tip. It looks like most of twice that size. And the idea is to put it really deep into your nose in a way that a human being would have trouble doing themselves, but a medical professional can perform. But the problem is, it also causes for a lot of people a kind of sudden impulse to sneeze. So you got a certain number of people who are going to be COVID positive. They're there with a healthcare worker, and their healthcare worker is right up close to them performing this test, and then the immediate reaction is someone sneezes right at the healthcare worker because they're right there in front of them. So that's not great. It's been what we've had. It's been the only option that appeared to be truly consistent and viable, and that required a healthcare worker to think about it, the face shield, the PPEs, everything. This ain't that. This is, like many of us have experienced at a doctor's office. They give you your instructions, and here's the sample cup that you spit into and you put the cover on, and here's the Q-tip, and bring it back and hand it over, and then they can package it and send it for processing. So it just takes away that close contact, that sneeze, the things that would create vulnerability for the healthcare worker. It's also, from what I've heard at least, has not been done to me, but from what I've heard, a lot more comfortable for the patient to not go through that deeper procedure. Doctors, that was my attempt to put it into plain English. You take it from there.
I think you did really well, Mr. Mayor. Everyone who has the nasopharyngeal culture done, the one up their nose, almost always coughs and sneezes on the healthcare worker because it's so uncomfortable. So new methods are really needed. In terms of the multiple specimens, in some cases, we may be able to do it just with a nasal swab, just swabbing the front of the nose, something that the patient can do under the supervision of the healthcare worker. As you keep saying and teaching people, we're learning new things about the disease all the time. We may find that adding sputum, spitting does improve the test characteristics or doesn't make it different enough. So we may just be doing the swabs. But I think the big point, which you've made so well, is that this will be safer testing. It'll be more comfortable testing for the patients. It will enable us to do more testing and reach your goal of being able to open the city safely with enough data to be sure that we don't have large outbreaks in the future.
Okay.
Next question is Christina from Chalkbeat.
Hi, Mayor. We have seen some reporting that the DOE is considering a grading policy that many advocates think is unacceptable. They don't want to see any grades for high school, and they want assurances that every student will graduate from high school this year. Just curious whether the DOE is taking that feedback, when we can expect an official policy to come out, and what the holdup is.
Yeah, thank you, Christina. Now, look, the focus has been over these last few weeks to really get the distance learning moving to the extent that we need it to, and to try and consolidate the education of our kids right now under the most adverse possible circumstances. 1.1 million kids spread out over a whole city, not a single one of them, in a classroom in the traditional sense, although some are at the enrichment centers. It's still not the classrooms that we knew, in the school structure we knew. So that's been the focus at the DOE, get that piece right and start building for the future, for the summer and for beyond in different ways. This week, we'll have an update on the grading policy. I've had detailed conversations with the chancellor and his team. We'll have an update for you. I will say, of course, the voices of the advocates and every stakeholder is listened to. And we want to be fair, and we want to be really respectful of students and families in this moment. We also want to strike a balance. I think it is important with everything in life that there be some real standards. I think it helps people to have some clear standards. And we think we can do that in a fair way that accounts for how difficult this experience has been. Clearly want to see as many seniors as possible move on at the end of this school year the right way. But we have to structure that in a smart way, and again, we'll have the details this week.
Next question is Henry from Bloomberg.
Mr. Mayor, how are you doing today?
Good, Henry, how you doing?
Okay, let me ask you this. I don't know whether you've ever spoken about this, but why do you think New York City has been such an epicenter for this pandemic, way beyond other cities that are densely populated and act as international gateways?
Well, it's a profound question, Henry. I've spoken a little bit to it, and I think we're going to keep researching that question going forward, but I would say you're on the right track. International gateway in a way that very few cities on earth are. I mean, I think we have to understand New York City, who we are, what we are, how we compare to the rest of our country, how do we compare to the rest of the world. We are one of the most international cities in the world, with a handful of cities as the true international capitals. That obviously in a pandemic makes us more vulnerable. We have the greatest diversity in the world, so we have people traveling back and forth from every part of the world, and we saw this pandemic growing from different parts of the world. And I think as we look at it more and more, we'll see that some of that came in from more than one location, and that was more of a vulnerability for us than it might have been for some other places. Yes, there are densely populated cities in this country, but there's nothing that compares to New York City. There's just no city that's laid out the way we are, that concentrates anywhere near as many people. That's a huge part of the equation. When you think of the second biggest city in the country, Los Angeles, it's structured entirely differently. It's spread out over a vast area. You have many, many fewer people concentrated in big buildings. There's many, many reasons why it made sense, very sadly, and the human cost has been profound and painful. But there's many reasons why we were particularly in the crosshairs of this disease. A lot more we'll say about over time. I think the other interesting question will be examined over time is, when all those challenges added up and this disease manifested so intensely, I mean, we never seen anything like it. I mean, again, the only parallel is 100 years ago. Thank God this city long ago devoted itself to having a very strong public health apparatus, Department of Health, health and hospitals, community-based clinics, and that is part of what saved us here because our hospital system was strained deeply, but it never broke. A lot of other places, if they had gone through the kind of overwhelming growth of the disease that we've gone through, their hospital systems would never have been able to handle it. Ours held, so that's something all New Yorkers should be proud of, and obviously the healthcare workers were the heroes. But those are some initial thoughts, Henry, but I think we'll all be doing a lot more research as we get more information.
Next is Gersh from Streets Blog.
Hello, Mr. Mayor. How are you?
I'm good, Gersh. How you doing?
Great. I appreciate that. So I do want to obviously talk about this massive open streets announcement you just made. You did use the term enforcement, so I need to understand a little about what's different now between what you're going to do and what the NYPD was doing with the original open space pilot. Have you accepted the council's position that open streets can be done with far fewer cops and with more trust in drivers to stay out of areas where they don't belong?
So I would say it this way. I mentioned, I think, in one of these settings, it may even have been in answer to one of your questions, I had a long conversation a few days back with Commissioner Shea and Commissioner Trottenberg, and we went deeply into the question of looking at each of the plans from around the country, something you and others have asked, Oakland, Minneapolis, et cetera, things happening around the world, and our comparison to New York City and what it would take here. And I think there is, an assumption in everything we do, and it gets back to Vision Zero, that we want to be very cautious about making sure drivers are constantly given the message, slow down, drive safely, recognize the ramifications of what it means to drive a vehicle and your responsibilities. So that worldview, Gersh, makes us very cautious when it comes to trusting that if you create a situation where there are not protections and there's not enforcement, that you could put people in danger. And obviously the goal of an open street or safe street kind of structure is that people can enjoy it and experience the virtue of it and the social distancing without having a new danger from vehicles. So we've always had a concern about enforcement and continue to, but the council, discussions with the council, I think were kindred in the sense that we could come up with places to open. I think the areas around parks are a great example, where by opening them up, you were going to capture the natural flow of people. One of the things, many of the questions I've gotten from all of you in the media, but beyond, is one of the most important places to open might be where a lot of people are going anyway, and just give them more space since more and more people will go there when it gets warmer. That also is actually a more straightforward enforcement dynamic than if you're trying to open a bunch of places all over. So it was sort of a focus on where the need was greatest, both in terms of where people would go and obviously communities most affected, using some of the enforcement we were already devoting to those areas in an efficient way. And then more and more of the conversation revolved, this is something the council felt deeply, and actually, as we looked at it more, we felt this was a very important piece, revolved around community partners that could be relied upon to create structures that, if you were going to have a place closed off, there would be a constant effort to monitor it, to make sure it was safe. If there was any problem, to get NYPD over there quickly. Something with a little more structure than, for example, what we saw in Oakland. So I think there's been a really good consensus that we can do something substantial while keeping the health and safety issues up front and ensuring the right kind of enforcement, more work with trusted community partners. But I would not go so far as to say, forgetting what we learned from Vision Zero, which is to always keep our guard up against the problems of people who drive irresponsibly and making sure we're protecting pedestrians at all times.
Next is Shant from the Daily News.
Good morning, Mr. Mayor. I was wondering if you could share some more details about the street closure plan. I mean, to start with, can you sort of help New Yorkers visualize what the plan will look like? Will there be barricades, police cars, officers enforcing? Also, can you say exactly who's going to be picking the streets? Will that be DOT or the council or somewhere else? And maybe last but not least, do you know at this stage what the first streets will be? Parts of Manhattan, Bronx, et cetera, anything like that?
Okay. So we're all going to work together on the selection council, mayor's office, NYPD, DOT, everyone's going to work to figure out the places that make the sense immediately. Again, I think it's going to be a combination. I think assume first and foremost those streets around parks, where that natural ability to expand, if you will, the park space and the places where a lot of people are going to be congregating as it gets warmer. I think in May we're going to see steady warming and more people. So let's get ahead of that, expand out around the parks. We'll figure out together where to focus. It's one part where you're going to see the most activity, another part where you're going to see the most need in terms of the health reality. So that's obviously a lot of the communities that have been afflicted the most. Yes, there will be enforcement. I think everything you said can and will be a part of it, meaning in some places barricades, but one of the open questions is, how permanent for the duration of this crisis the barricades need to be, or how temporary they can be, what will be effective. Yes, there has to be enforcement attached. Depending on the location, it might be more enforcement. Other places, it might be less, so long as, again, there were trusted partners. Bids have come forward as one example. Certain neighborhood entities that work very closely with the NYPD. This is an idea that Commissioner Shea put forward. If the NYPD has a working relationship with an organization and knows that they can rely upon them to manage something and keep in touch if there's a problem, that makes sense. So, and timeline to move obviously as quickly as possible through the month of May, but to start where we think there will be the most activity, and then build from there. Details will be announced. We have to deepen this process with the council and with the agencies. As we have the first tranche of the places that will occur, we'll announce that.
Next is Yoav from the city.
Hi, Mr. Mayor. I wanted to ask you about the 3 indicators the city is tracking. For the percentage of people tested who are positive for COVID-19, why are you guys separating out the public health lab? My understanding is that that's a very small subset. I guess if you can tell me how many tests the public health lab is conducting, and is that a special group of people? I'm just trying to understand why it's being separated out.
It's a great question. Appreciate it, Yoav. So the indicators, I'll start and I'll turn to Dr. Daskalakis and Dr. Varma to speak about this. The indicators were developed because we wanted everyone to be able to see in common where we were going, but there was real concern that, and I think this is playing out in certain states right now in a very troubling way, that if you either didn't have clear, transparent indicators, or you used the wrong ones, or you didn't give them enough time to develop, you could really set up that horrible boomerang scenario where the disease reasserts. And the disease reasserts, I have no words for how much of a problem that would be if it reasserted in a strong way, both in terms of the people who would be in danger and the lives that might be lost, but also setting back any effort to get to normalcy. I've said we're not going to be in a perfect straight line on our path back, but we need to keep it as tight as humanly possible. So having these indicators, it was a conservative act to choose 3 indicators. Again, Yoav, you'll appreciate this. On this matter of how and when to reopen, I'm a conservative. I'm a proud conservative in this matter only. But the getting it right, being cautious, being smart, looking for the correlation of the indicators, that was the underlying value. Yes, the public health lab is sort of a rarefied slice in my layman's terms. It's a high bar, but we thought it was right to have it there because we wanted a high bar. We wanted to make sure we were really cross-checking all our indicators and seeing something consistent. We're going to see how it plays out. We always have the option to reevaluate down the line, but so far I think what we've been seeing tracks with what I believe is happening, which is we are getting steadily better, but we're far from out of the woods. Look at the number of new cases every day. Look at the number, tragically, of New Yorkers who we're losing every day. It's better than what it was, a month ago or a few weeks ago, but it's nowhere near what we want it to be and need it to be. So I think the indicators are doing their job right now. But Dr. Daskalakis, Dr. Varma, why don't you jump in?
Thank
you, Mr. Mayor. So the public health lab actually focuses on testing inpatients. So it's the sickest New Yorkers who are being tested. The indicator, the reason that they're together in a graph is because we want to look at them in combination of sort of the sickest folks who are being tested, as well as just the general population who's being tested. So we think it gives a pretty robust view. And again, like the mayor said, we really will be able to adjust these further if necessary. But the most important message is that the trend is definitely down in both. So day-to-day variations to be expected, especially since we test fewer folks in the public health lab. But again, since the trend is down, we are going in the right direction and does provide for some cautious optimism.
Dr. Varma, you want to add? I guess he doesn't want to add. Okay, go ahead.
Next is Gloria from New York One.
Hi, Mr. Mayor. Thank you. I have two questions for you. The first, I understand what the doctors have explained about how this test is easier to administer, but is there anything they can say about how you eliminate or prevent the possibility of a person not self-administering this test correctly? If they do it wrong, then is there a possibility that the test might get a wrong result? How do you monitor that if the idea is to send the person off into another space to administer the test? And my second question is about the streets plan. I thought much of the discussion around this had been about giving people who might not have access to, say, a park or a large area of open space options. So why start with places that are near parks? Why not focus in places where people might not have immediate access to a green space or a place to spread out and take a walk?
So I'm going to speak to that one, and then I'll turn to the doctors on the self-swab issue, and I think a very good question you're asking about how do you make sure the tests are accurate. I think the crucial question here, Gloria, is about health and safety. So when you think about social distancing and the ability to help people do it effectively, and New Yorkers have been amazing, but obviously space is something we are all challenged by here in general, even when we're not doing social distancing. It stands to reason the first concern from a health and safety perspective is where are the most people going to be? And how do we help address that? And of course, the warm weather coming on, and this is something we talked a lot about with the city council, that the warm weather is going to change the dynamic. It's going to make it more challenging. So the notion of going where the people will be, which we know will be a lot of the places they'll be attracted to, we're already seeing that on a few nice days we've had, that's about maximizing the impact to protect people, to give the most people the most opportunity to socially distance. Again, there'll be a focus on making sure we can do it the right way and enforce it, and there is an efficiency to focusing on the places we're already doing a lot of enforcement and just building them out more, if you will. And as I said, there's going to be a real focus on the communities that have been hardest hit. Every community in New York City has some kind of place for recreation. It's by no means even and equal, but every place has some places, and folks do congregate all over the city, every kind of community in those places, so it makes sense to focus there. I think as we think about expanding outward, it'll all come back to where can we find those local partnerships that we can trust to make sure that people are safe. Again, different from the Oakland model, which was, I think, a more honor system kind of model. As I said, we want something more backed up by a structure and by monitoring and then by enforcement when it's needed. But we can do that in a number of communities, obviously, so that'll be an option as well. But I think the first concern should be to think about where the most people are going to be, how quickly they're going to be there, and try and get there first, and that's around the parks. But we'll do these other pieces as well. We're talking about a substantial amount of space that'll be addressed, and we'll work with the council on those priorities for sure. Let me turn to the doctors on how you make sure the self-swab test is done accurately. Mitch, you want to start?
Yes, sir. Thank you. At least in the beginning, we will not be asking people to go into a separate room. What we'll be doing is setting it up so that they're looking into a mirror and the healthcare worker is behind them, thereby protected from them, the healthcare worker being sneezed at or coughed on. but they'll be able to observe in the mirror and help to instruct the person on how to do it. We may be using for healthcare workers who need to be tested and who are therefore very familiar with the procedure. We may allow them to go into a separate room. And as you keep saying, as we learn more and more about these diseases and these technologies, we may be able to liberalize it. But I think in the beginning, it is appropriate that a healthcare worker be observing it, but way less risk to that healthcare worker.
Mr. Mayor, I'll just build on what Dr. Katz said, and if Dr. Daskalakis wants to weigh in, I would say that, Gloria, there are other situations where we work with patients for them to do self-collection. So, for example, in our Chelsea clinic, we have a clinic where patients can self-collect samples to do testing for sexually transmitted infections. We provide patient education materials that easily walk them through step by step how to conduct the self-collection to make sure that we have samples that we can test accurately.
Good. Okay.
Next is Nolan from the Post.
Mr. Mayor, can you hear me?
Yes, Nolan, how you doing?
I'm all right. How are you?
Good, man.
I have a couple of questions on two separate topics. The first of which is I was wondering how your own personal experiences in the park changed your mind or decision making when it came to opening streets around parks. I know when I've been riding my bike on the weekends, especially along Kent, the streets and the sidewalks have all been packed with people. I'm wondering how your experiences in the park shaped any change in decision that you made. And secondly, you've repeatedly talked about the importance of testing throughout the entirety of this crisis. The New Yorker published a story yesterday that said that in early March, you were brought a proposal to test flu swabs that had already been taken to see if they contained coronavirus. I'm wondering if you can comment on that story and why it took your administration, according to the story, the better part of 3 weeks to okay that proposal.
So on the first question, Nolan, I've been watching carefully as I've gone around the city and tried to always check to make sure that I was watching for how much people were distancing, as we told people it was important to use face coverings, how much people were using them, all these different realities, how much people appeared to be out versus, different points. And that's part of why I've been praising New Yorkers throughout is I've just been really moved and impressed by what I've seen. It's been so consistent how much effort people are going to distance and how much adherence there is to the face coverings. There's more to do on that front, but still it's pretty remarkable. And when you think about the places I've gone, when I've gone to different public hospitals or voluntary hospitals, I was at Rumsey in Staten Island, Kings County Hospital, Bellevue, Elmhurst, Lincoln, looking around the neighborhoods as I was there. My own, you're right, I've kept an eye out whenever I've been in a park, and I've been in several different parks getting a sense of that. Talking to our different commissioners, but Commissioner Shea has been particularly focused on this issue of going out and seeing for himself, places like Central Park, Riverside Park, Hudson River Park, but talking to all of his commands about what they're seeing. And I think it became clearer and clearer that the parks were filling up in nice weather, but people were still doing a pretty admirable job of keeping distance. When you saw folks together, it tended to be people who were family groups, or people obviously were in relationships under the same roof by and large. So the impulse that people were living by was really good. But the question has been coming up more and more. It's going to get warmer, and we've all been having these constant conversations. When it gets warmer, what's it going to look like, and what new stresses and strains is that going to create? And that's where a lot of the energy came from, to think about what can we do around the parks and particularly to expand them out, if you will. And certainly the city council have been thinking a lot of the same things, and it was a good consensus. So yes, everything I saw in parks but beyond made me feel we had to help people continue to be able to socially distance, and that a lot of the nexus would be around the parks as it got warmer. On the question of the New Yorker piece, I have not read the piece. What I've had summarized to me doesn't make sense to me. So I'll look at it and I can speak about it in more detail. Whenever we've heard of any opportunity to get more information, and I remember these conversations vividly, we wanted to maximize anything that would bring us more information on what was going on and anything that would help us reach more people to help them know their health status. So I'll give you a more thorough answer after I've read it, but from what I've heard so far, it does not bear a resemblance to what I remember.
We have time for two more. Next is Andrea from CBS.
Hi, good morning. My question is pertaining to the task forces that you announced yesterday. Will the city not consider or delay reopening until those task forces come back with recommendations in June? And to that end, Mr. Mayor, you campaigned on a platform to address inequalities in the city. Are you now using these committees and task forces to make up what you haven't been able to accomplish during your tenure?
So on the first part, no. The reopening will move as quickly as is safe and healthy, obviously based on the indicators and deliberatively. And we're going to be very, very transparent about what can happen in each phase so long as we keep making progress, which is the good incentive for every one of us to keep doing the things we're doing and keep showing the discipline that New Yorkers have shown. So no, these groups will come forward immediately to work on both issues of the immediate restart and the bigger recovery. I've said with those sector-specific groups, for example, we'll have one for small business, we'll have one for larger businesses. We're going to start meeting with them right away because we need their input as we're figuring out restarting plans. Obviously, we want to hear from the people who will be most affected and the people who know their businesses best and their employees best. Think about the fact that May is our first chance to even begin any kind of restart. That will depend on the indicators going in the right direction. And it will require, careful, smart efforts, and then you test them, Andrea. You do some relaxing, say, of a particular rule, and then you watch the impact of it. Is it working? Is it enforceable? So that's all going to play out starting in May. These groups are going to be meeting in a matter of days to give us initial input, and then they'll keep giving us input throughout. That June 1st initial roadmap that I'm expecting from the Fair Recovery Task Force is to set some parameters on how we're going to go through a bigger recovery process and do it in a way that actually helps us address some of the real disparities we've experienced and have a smart and effective recovery that reaches all. So we'll get that on June 1st. We're clearly not going to be all recovered by June 1st, so that will be more than timely. So no, none of this slows down anything the whole rest of the government will be doing. It augments and advises and gives us more perspective. To your other question, no, I'd say the reality is 6 years we've been fighting inequality, and in many ways that have been profound. I mean, hundreds of thousands of people came out of poverty as a result of these initiatives, and obviously now many, many hundreds of thousands of kids got pre-K, and I could go through a whole list of things that have happened that have changed the lives of New Yorkers. No question that that was the right direction. Also, no question that didn't solve inequality. No one said that that's enough to solve the fundamental problem. We just have to keep fighting. We have to keep going deeper. Now, I think this moment is a transformational moment. The first and foremost is to protect the health and safety of all New Yorkers and to rebuild an economy so everyone can get back to work. But remember that comparison, I say it with the deepest humility, Andrea, that this city was in another crisis, 80 years ago, that really paralleled some of what we're going through now. And New Yorkers led the way. And instead of saying we're going to repeat what we had before, including the mistakes we had before, they were devoted, led by giants like Franklin Delano Roosevelt and Fiorello LaGuardia. They were devoted to bringing us back, but making our society better and fairer at the same time. That's what I aspire to start. I've only got 20 months, but in those 20 months, we're going to take some very big steps in that direction and then leave the city a clear, bigger roadmap of where we go from here. And I believe these actions can take another big bite out of inequality and move us forward.
Last question for today goes to Alan from 1010 Wins.
Good morning, Mr. Mayor. How you doing?
Good, Alan. How are you?
I'm fine. Two for me. The experience needed for those 1,000 contact tracers the city is hiring, and what does it pay? And then the second one, we have groceries, pharmacies, essential businesses have been open now for some time with the new standard, the masks, the gloves, the social distancing. When do you see other businesses opening with the same protocol? It seems that maybe there are other businesses that could open right now with the right precautions.
Let me do the second one first. Alan, I would be careful about that. And I think, again, there's a bit of a tale of two cities going on here in this country. The places that seem to be putting, economics ahead of human lives, and then those of us who are trying to focus on the health and safety of people first, and then build out our economic restart from there. If we're not making decisions based on healthcare indicators, there's something wrong. If we're not making sure that, like I said, that sort of foothold idea of you're climbing a mountain or something, you get your foothold and make sure it's secure before you go up to the next one. I mean, right now, we're still very much in the throes of this. It is better than a few weeks ago, but we're very much in the throes of it. And, we're not going to make a sudden move that sets us back. So when you talk about, what could you reopen safely, we want to be very smart about that, because imagine for a moment, you start to reopen a lot of stuff and people start to get looser and they don't do as much social distancing and they don't wear as many face coverings. Now the disease starts to spread again. And here comes that boomerang. We can't have that. We have to believe that when we have that jump off moment, it's one, we've really seen the indicators go down. Two, that handoff I talked about to the testing and tracing. Remember, the testing and tracing is like an offense. It's like a fight back against the disease, because you're finding people proactively, identifying who has it, and then tracing the people in their life and getting them testing, and everyone who needs isolation gets it. That apparatus is being built right now. That's going to empower us, if the indicators are with us, to open up more, because we're pushing back the disease constantly through that effort. So when you get to that kind of point, yeah, you can say, here's some places we can start to open up. And yes, as you said, with face coverings, with gloves in some cases, whatever it might be, with distancing. But I wouldn't suggest that just those precautions solve the underlying problem. I think we have to make progress on the root cause here and then start to open up slowly but surely. And the better we do, the faster we open up, the more we open up. On the question of the contact tracers, and I don't know if there's someone on the phone of our doctors who can answer right away, pay levels and things like the questions Alan asked. Hold on, I've been handed a note. I guess I can answer this because I've been handed a note. Thank you, Freddie. So the annualized pay, would be in the $55,000 to $65,000 range. So we're talking about folks who have some kind of healthcare background and can come on board, and that is the range. But we'll get more details out, unless one of the other doctors can speak to any of the other specifics of Alan's question. What I can say is we're hiring right away, and the details will be online at the Fund for Public Health website. Unless one of the other doctors has something to add, let me give him that chance. Okay. So Alan, that's some initial information, but we will get more to you today, and we'll put it up online today so everyone can see it. Okay, everyone, look, as we conclude, I do want to say a very pleasant thing to have a good Monday morning, and we're having a good Monday morning. We're taking a big step forward here with testing. The fact that we can do testing now in a simpler, faster way is going to improve everything. It's going to allow us to fight back better and faster. It's going to protect our healthcare workers more. It's going to be a better experience for everyone who gets tested too. Not a minor matter. That's a really good thing. I spoke to some of the folks online at the Morrisania Clinic in the South Bronx on Saturday morning, and you're not surprised to hear they were anxious. They were worried. They were worried for themselves. They were worried for their families. The test was going to be a moment of clarity and definition, and the test was going to tell them something. And I talked to the healthcare workers. They were outstanding. I want to thank everyone at the Morrisania Clinic. They really, really impressed me. What they said is, you know, people, of course they want answers, and they want to know what to do next, especially if you test positive. How do you stay safe? How do you keep your family safe? How do you isolate? If you test negative, you still have to take precautions. So the fact is, anytime we can make that simpler, people are going through a lot. They're worried. They're looking for answers. If we can make it a simpler process, a better process, more comfortable process, that's a good thing unto itself. But imagine now the ability to get a lot more tests done, simpler, less danger to our healthcare workers, thank God, and something that allows us to move forward without being dependent on some of the sources we used to be dependent on. Again, that does not mean we no longer need the federal government. We do, because we still need the lab capacity. And again, to the labs, help us out. This test is going to make everyone's life better. Join us in that effort. To the federal government, work to make sure the labs are doing that. Work to make sure we have all the supplies we need at those labs. We expand lab capacity. Testing, testing, testing. When we can do this truly on a bigger level all the time, that's when we're going to be able to beat back this disease even more. So a good step in the right direction today, and a lot more to come in the month of May. Thanks, everyone.
In 60 years, we went from about 100,000 factory workers to probably about 7,000.
Off in the distance, you can see some factories that are still humming, but most of them are just kind of abandoned.
The restaurant industry right now is one of the largest and fastest growing industries in America. And yet it continues to be the absolute lowest paying employer in the United States.
Barely anybody's making enough to live.
You were donating plasma to get by.
It's literally a slave wage.
I don't remember growing up like this. My mom didn't have to go to food banks. It's pretty sad.
Go to the ends of the earth.
Right now.
We got something crazy.
And reach for the stars.
Here we are.
Tom.
Yes, it's my comeback.
Hey, this is pretty fun. But wait, there's more.
Experience thought-provoking.
Welcome to the idea of being a human being.
Innovative and truly original reporting.
Look through a telescope and go, wow.
Because there's always something new under the sun on CBS Sunday morning.
How do we put this in perspective about how worried we should be.
We're going to share the newest numbers and critical information on the outbreak.
Vladimir Duthier is tracking the plight of the restaurant business. Vlad?
You've been talking to doctors. What are they saying to you about their experiences?
In times of uncertainty,
Dr. Fauci, it does seem like so much of this we're making it up as we go along.
when you have more questions than answers,
Does flattening mean that we'll soon see a decrease, or does it suggest there's a plateau?
well, that is a great question. There's one voice you can turn to for
We
truth,
want to turn now to the important issue of mental health.
understanding,
How do we socially distance without emotionally distancing ourselves?
and making sense of our world.
We are all in this together.
The CBS Evening News with Nora O'Donnell on CBS.
There are more than 2.9 million reported cases of COVID-19 worldwide and over 200,000 deaths. Now, we have new information out today about symptoms of the deadly disease. Let's bring in Dr. Shoshana Ungerleider. She's an internal medicine physician with Sutter Health. Doctor, good to see you again. So the CDC has added 6 new possible symptoms of COVID-19. Walk us through what they are.
Yeah, thank you, Vlad. As we all know, this is a new virus, and we're learning about it as we go and trying to gather as much new data as possible. And we found that the initial symptoms people present with can be highly variable. Things like chills, muscle pain, headache, and sore throat are common and then often accompany viral infections, including COVID. Interestingly, we've heard that the loss of smell and taste can be some of the earliest signs of a COVID-19 infection, and sometimes it can be the only sign, although it may not affect every patient with COVID-19. We know that the loss of smell and taste are definitely associated with the disease, and therefore we can use that as a screening tool. Some of those other symptoms typically accompany many other kinds of viruses, so we should all be kind of paying attention to new symptoms as they arise, but especially that loss of smell and taste.
So we've talked a lot about how people with underlying health conditions are the most vulnerable, but you know what that means is still, I think, debated, at least among sort of regular people. Obesity's on that list. How does obesity affect your susceptibility to the virus?
Yeah, that's right, Anne-Marie. Severe obesity is correlated with more severe cases of COVID-19, so those that require hospitalization and intensive care. So people who are obese, of course, can have other high-risk health conditions like high blood pressure or diabetes. However, even patients who don't have other underlying health problems, we're finding those folks are getting sicker from COVID and requiring ventilation. And this may be because severe obesity predisposes people to breathing problems. They may have underlying sleep apnea, which impacts your lung function overall. And then we also know that obesity impairs your immune system, which is your ability to fight off infection. So in America, 40% of people are considered obese, and 18% of Americans are considered to be severely obese. So we're learning that potentially many millions of Americans are at higher risk of severe illness from COVID, unfortunately.
That is troubling because of the statistics that you mentioned, Doctor, with regards to here in the United States. I have another question for you, which has come up recently. The World Health Organization says there's no evidence to support that having coronavirus or COVID-19 prevents a second infection. I mean, I know that this is there's still a lot that we're learning about coronavirus and COVID-19, but what do we know about people who are infected with COVID-19 and whether or not they can be reinfected? Presumably, if it's like most viruses, you do develop antibodies once you are infected, right?
That's right. And this is really important. I think you pointed this out. There's still a whole lot that we don't know about the virus, including this very important question of immunity. Meaning, right, if you get infected and create antibodies to it, proteins in the blood, are you then immune to getting it again? And if so, for how long does that immune response last? Those are the key questions. We just don't know whether or not patients who have these COVID antibodies are still at risk of reinfection. Typically with other viruses, you do create an antibody response. It lasts for somewhere up to weeks or months. But unfortunately, until we do know in the case of COVID, we have to assume that even if you test positive for antibodies, you could be at risk for getting it again. And so people who do test positive for those antibodies shouldn't change their behavior in any way at this point. It's important to continue social distancing for now.
Okay, so if you do have the antibodies, though, we've been seeing stories of people donating blood and so on and so forth. If you've had the virus, you've recovered, is there anything you can do to sort of help in this quest for a vaccine?
Yeah, that's right. There are, in some places, they are doing studies about whether or not donated plasma from people who have recovered from the virus, whether those antibodies can then be transfused into people who are actively fighting the infection. The jury's still out. We don't know whether or not those the convalescent plasma donations are actually helpful. But if you are somebody that's recovered, it definitely makes sense to look up whether or not in your area you're able to go and donate plasma to potentially help people.
Doctor, before we let you go, I've got a question about the fabric mask that everybody is now wearing in many states. Here in New York City, you go outside and you see most New Yorkers wearing them. What's the correct way to care for a fabric mask to help effectively prevent infection?
Yeah, great question, Vlad. Right, so cloth masks are everybody should be wearing if you have to leave the house. These should ideally be washed after every use in a washing machine, if possible. And be really careful to not touch your eyes or your nose or your mouth when you're taking off your mask. And then, of course, wash your hands immediately afterwards, after touching it with soap and water for 20 seconds. And then another important thing to note, if you've been wearing your mask for a while and you have holes in it or it's stretched out and it's no longer covering your nose and your mouth, it needs to be thrown away. So people should know that masks alone are not particularly effective in preventing infection. The best way to prevent getting COVID or to prevent infecting other people is to stay at home if you can.
All right, Dr. Ungerleider, thank you so much for all the information that you've given us. Appreciate it.
Thank you.
What are your constitutional rights during a pandemic? We're going to be talking to CBSN legal contributor Keir Dougal about the specifics that you need to know after this short break.
Suddenly, it seems everything around us has been turned upside down.
What can people use in terms of their faith in order to get through these very difficult times?
The main thing is you're not standing there alone.
And our new normal is something we're all trying to figure out.
10,000 people with medical experience have stepped up to volunteer.
So we're saying we're all in this together. It's incredible, Mola.
Now, we need a place to turn to.
Dr. Jerome Adams, how soon could we have a therapeutic in the hands of our caregivers?
For answers.
Should we be advising people to wear masks?
Great question.
Truth.
Joining us now for an exclusive interview is the Secretary of Defense, Mark Esper. Let's get to that urgent situation aboard the USS Theodore Roosevelt.
And to make sense of our world.
We're all trying to learn something during this crisis.
We're all in this together. You got to help each other out, no matter what.
He's got it right.
The CBS Evening News with Norah O'Donnell on CBS.
Go to the ends of the earth.
Right now.
We got something crazy.
Oh!
and reach for the stars.
Here we are.
Todd.
Yes, it's my comeback.
Hey, this is pretty fun. But wait,
There's more.
Experience thought-provoking,
Welcome to the idea of being a human being.
innovative, and truly original reporting.
Look through a telescope and go, wow.
Because there's always something new under the sun on CBS Sunday morning.
President Trump did not appear in public over the weekend to address the global pandemic. His absence comes as CBS News learns top White House aides have been urging him to scale back on press briefings. Ben Tracy is standing by at the White House to break this all down for us. So Ben, we're also learning today, I think I saw an email from you earlier, that the president says that there will, or the White House says there will be no briefing this afternoon. What's behind the change? What are you hearing?
Yeah, so there's supposed to be a coronavirus task force briefing at 5 o'clock here at the White House. They say that has now been canceled. This comes as the president's getting a lot of advice from people both inside and outside the White House that these briefings are not particularly helpful to him. You even heard some Republican governors and lawmakers in recent days saying they wish the president would speak less at these briefings and let the experts kind of do the talking for him. But it seems that the White House is taking more of a tact of just canceling the briefings altogether. They did not do any this weekend. They're not doing one today, although they do say the president will have a brief media availability at an event that he has at 4 o'clock this afternoon. But we're also hearing from the White House that they're looking to kind of reimagine what these briefings might be and what they might focus on in the days to come. That's what the press secretary told us today. But basically, one other thing, the president is very attuned to his poll numbers, and his poll numbers, especially in several swing states that are very important to his re-election, have been trending downward. And so it's possible that it finally got through to him that this is not beneficial to him and that perhaps speaking less would help him a little bit more.
But we all know that just because the president isn't speaking at the podium doesn't mean he's not getting his message out, because he's an avid Twitter user. He's been tweeting a little bit about the reaction to his handling of the coronavirus. How's he been using Twitter?
Yeah, so the president had quite a day on Twitter yesterday, a kind of gloomy Sunday here in Washington, D.C. He was very active on Twitter. The president doesn't tend to use that to really disseminate a lot of helpful information about coronavirus or his response to it. It's mostly a lot of retweets of his supporters saying that he's doing a good job. And then it's the president's way of basically fighting back against stories that he doesn't like when he sees them on television or in newspapers. So this weekend, he was basically refuting a New York Times piece that said that he's isolated here at the White House, that he's been eating French fries and hamburgers every day. The president said, "I'm not sitting here at the White House angrily eating hamburgers." He also went after journalists, which is a favorite target, saying that they should give back their Nobel Peace Prizes. He actually said the Nobel Prize, which those don't go to journalists. Those are Pulitzers, so there was some confusion in some of his tweets. But the president was really talking about a lot of things this weekend that did not directly relate to coronavirus and how it's impacting regular Americans.
So Ben, let me ask you, you know, it's interesting. I wonder what the White House, your White House sources are telling you about the guidance that they're giving President Trump, not just with regards to the things that he says that are true or that are not true, or they're misleading from that podium, or are in fact, you know, horrible advice that nobody should absolutely follow. But why the president, even if he isn't appearing at these briefings, why he isn't using his Twitter account, for example, to talk about the people who have died, the more than 50,000 people, Americans, who have perished because of this pandemic, as opposed to using his Twitter account to, pick fights with the press or pick fights. He's even attacking Fox News. I mean, I'm just trying to get a sense of who's advising him. And if you're not able to get that message through, I guess then you're not doing your job. These people that are making up the advisory team that the White House, that the president is supposed to be listening to. I'm just not clear that I understand, even if the president has these grudges and he wants to pick them and that he wants to take on the media and the press and other people, why there aren't a group of people saying, you know what, you should maybe be talking about the families who are suffering right now, or the small business owners who aren't getting, who aren't able to work and who are letting people go. Why aren't there more people telling him to do that?
There certainly are White House advisors who would tell him to do that and have told him to do that. But we also often hear the caveat here, in the end, the president is going to do what he wants to do. And I think long ago, they really stopped trying to rein in his Twitter habits. That's just not something that seems possible for anyone here at the White House to change. But what the president does on Twitter is really mirrored by what he's done in the briefing room. He has spent very little time during those briefings talking about all the things you just mentioned, talking about the Americans who have lost their lives, talking about people who have lost their jobs. It's a lot of self-congratulation, and it's a lot of him trying to focus on whatever is a piece of good news that he feels could potentially help the stock market or the economy. So that seems to be where the president's head is at. This seems to have taken a turn, though, last Thursday, when you'll recall the president basically openly speculated about ingesting disinfectant and what effect sunlight might have on killing the virus. He got so much blowback from that, both from Republicans, Democrats, the media, all across the board, that perhaps that went into this decision to either cancel these briefings altogether or at least rein in the amount of time he's spending on them.
Okay, so then there's going to be a shift in messaging is what we're hearing from the White House. They're going to focus on something else, not on the health component of battling this pandemic. What are they going to be talking about? Because the economy is not looking too good either.
Yeah, that's a tough message, but they basically do say that they want to pivot towards talking about the economy, talking about the reopening. The phrase the press secretary just used here moments ago, she said, we're now in the reopening phase of this, so we're going to change the focus of these briefings when we do have them. So based on that, you can expect to see and hear less from Dr. Birx and Dr. Fauci, and perhaps hear more from the president's economic advisors as they try to talk about how these states and cities safely reopen and get businesses back open. That has certainly shifted here at the White House. They are talking behind the scenes and on camera every day now about reopening. And they do give the caveat that it has to be done safely and that states shouldn't do it ahead of when these guidelines say it. But that is very much the focus now. It's not necessarily about counting the number of cases and testing and all that. It's how do we get the economy back online.
And finally, Ben, President Trump on Twitter is expressing support for HHS Secretary Alex Azar, after there were many reports out there that his job may be in jeopardy. What are you hearing? What's the latest?
Well, that was part of the president's tweet storm yesterday. He did say that the reports that he's about to fire Alex Azar are not true. He called that fake news. He said that Azar is doing an excellent job. Azar, right after the president tweeted that, he tweeted his own tweet saying these reports of that I'm going to be fired are fake news. So I guess they're in agreement on that. But it's no secret here at the White House that Alex Azar has not been well thought of by some of the president's advisors based on his initial handling of this coronavirus crisis. And so there's some bad blood there. And so there has been speculation now for weeks that he might be on the chopping block. But it appears that his job is safe, at least for this 24-hour period.
All right, Ben. Ben, I know there's no such thing as a Nobel Prize, but in my book, you get one. Thanks for answering all those questions for us and doing the job that you do. We appreciate it.
Right back at you. Thanks.
All right, let's take you now to the World Health Organization. They are holding a press conference updating the world on the global pandemic. Let's watch.
Intervention liminaire avant de passer aux questions et réponses.
Thank you, Tariq.
Dr. Tedros. Merci, Tariq.
Good morning,
bonjour,
good afternoon, and good evening.
Et bonsoir.
First of all, we're pleased to have interpretation services available in Portuguese today. And I would like to welcome all Portuguese-speaking journalists to join. The next will be Swahili and Hindi. And we will continue as WHO to invest in multilingualism because our beauty is our diversity. WHO remains committed to providing access to as much information as possible in as many languages as possible and reach every corner of our world. I have said since the beginning that the most important resource in the fight against COVID-19 is solidarity. Solidarity, solidarity, solidarity. The launch of the Access to COVID-19 Tools Accelerator on Friday was a powerful demonstration of that solidarity. WHO is deeply grateful to the many world leaders and partners who have come together to ensure no one misses out on life-saving vaccines, diagnostics, or therapeutics. We look forward to more countries and stakeholders supporting this global collaboration, this global movement. This initiative is a vital investment in the response, both for the short term and the long term. Diagnostics are helping us now to find cases and ensure people are isolated and get the right care. And we're hopeful that the Solidarity trial will shortly help us to understand which therapeutics are the most safe and effective for treating patients. But ultimately, we will need a vaccine to control this virus. The success in developing effective drugs and vaccines for Ebola reminds us of the enormous value of these tools and the enormous power of national and international collaboration to develop them. WHO played a key role in the development of the Ebola vaccine, and we're doing the same for COVID-19. Developing a COVID-19 vaccine has been accelerated because of previous work WHO and partners have done over several years on vaccines for other coronaviruses, including SARS and MERS. Although COVID-19 is taking a heavy toll, WHO is deeply concerned about the impact the pandemic will have on other health services, especially for children. Children may be at relatively low risk from severe disease and death from COVID-19, but can be at high risk from other diseases that can be prevented with vaccines. This week is World Immunization Week. Immunization is one of the greatest success stories in the history of global health. More than 20 diseases can be prevented with vaccines. Every year, more than 116 million infants are vaccinated, or 86% of all children born globally. But there are still more than 13 million children around the world who miss out on vaccination. We know that the number will increase because of COVID-19. Already, polio vaccination campaigns have been put on hold. And in some countries, routine immunization services are being scaled back or shut down. With the start of the Southern Hemisphere flu season, it's vital that everyone gets their seasonal flu vaccine. Even when services are operating, some parents and caregivers are avoiding taking their children to be vaccinated because of concerns about COVID-19. And myth and information about vaccines are adding fuel to the fire, putting vulnerable people at risk. When vaccination coverage goes down, more outbreaks will occur, including of life-threatening diseases like measles and polio. Gavi, the Vaccine Alliance, has estimated that at least 21 low and middle-income countries are already reporting vaccine shortages as a result of border closures and disruptions to travel. So far, 14 vaccination campaigns supported by the Gavi against polio, measles, cholera, human papillomavirus, yellow fever, and meningitis have been postponed, which would have immunized more than 13 million people. The tragic reality is that children will die as a result. Since 2000, Gavi and partners, including WHO, have helped vaccinate more than 760 million children in the world's poorest countries, preventing more than 13 million deaths. Gavi has set an ambitious goal to immunize 300 million more children with 18 vaccines by 2025. To reach this goal, Gavi will require $7.4 billion in its upcoming replenishment. We call on the global community to ensure Gavi is fully funded for this life-saving work. This is not a cost. It's an investment that pays a rich dividend in lives saved, especially in our children. Just as immunization has been disrupted in some countries, so have services for many other diseases that afflict the poorest and most vulnerable people, including malaria. As you know, Saturday was World Malaria Day. And a new modeling analysis published last week estimates the potential disruption to malaria services from COVID-19 in 41 countries in sub-Saharan Africa. In the worst-case scenario, the number of malaria deaths in sub-Saharan Africa could double. But that doesn't have to happen. And we're working with countries and partners to support them, put measures in place to ensure that services for malaria continue even as COVID-19 spreads. As lockdowns in Europe ease with declining numbers of new cases, we continue to urge countries to find, isolate, test, and treat all cases and trace every contact to ensure these declining trends continue. But the pandemic is far from over. I repeat, the pandemic is far from over. WHO continues to be concerned about the increasing trends in Africa, Eastern Europe, Latin America, and some Asian countries. As in all regions, cases and deaths are underreported in many countries in these regions because of low testing capacity. We're continuing to support these countries with technical assistance through our regional and country offices and with supplies through solidarity flights. In the past week, we have delivered supplies to more than 40 countries in Africa, and more are planned. Globally, WHO has shipped millions of items of personal protective equipment to 105 countries and lab supplies to more than 127 countries. And we will ship many millions more in the weeks ahead, and we're preparing aggressively. Later this week, WHO will launch its second strategic preparedness and response plan, with an estimate of the resources needed for the next stage of the global response. I would like to thank the People's Republic of China, Portugal, and Vietnam for their recent contributions to WHO strategic preparedness and response plan. We are also grateful to the more than 280,000 individuals, corporations and foundations who have contributed to the Solidarity Response Fund, which has now generated more than $200 million. And I thank Flu Lab especially for its contribution of $10 million. We have a long road ahead of us and a lot of work to do. WHO is committed to doing everything we can to support all countries. But political leadership is also essential, including the vital role of parliaments. As a former parliamentarian, I fully recognize the big role that parliamentarians can play. Tomorrow, I'll be participating in a webinar for parliamentarians hosted by WHO, the Interparliamentary Union, and the United Nations Office for Disaster Risk Reduction to discuss the role parliaments can play to reduce risks, strengthen emergency preparedness, and increase resilience. I continue to call for the world to come together in solidarity and national unity to confront this pandemic, but also to prevent the next one and to build a healthier, safer, fairer world for everyone, everywhere. But I repeat, national unity is the foundation for global solidarity. Solidarity, solidarity, solidarity. That's what we will say every single day. This virus will not be defeated if we're not united. If we're not united, the virus will exploit the cracks between us and continue to create havoc. Lives will be lost, and even every single life is very precious. We can only defeat this virus through unity at the national level and through solidarity, genuine solidarity at the global level. I thank you.
Thank you very much, Dr. Tedros, for these opening remarks. We are joined also by Dr. Soumya Swaminathan, WHO Chief Scientist, who may also answer some of the questions. I will remind journalists online that if you're on Zoom, you have an option of simultaneous interpretation in 6 UN languages and Portuguese. So welcome to ask question in your language. Please be short and one question per journalist, so we try to get as many as possible today. I would like also to thank all the interpreters who are here with us and making sure that our message goes out in different languages. So if we may start, let's start with Jamil Chade, covering Brazilian media, and he is Geneva-based correspondent. Jamil, please. Do we have Jamil on the line?
Yes, I'm here.
Yes, please go ahead, Jamil.
Yes, Dr. Tedros, I'm going to ask in Portuguese, hi, before all, but I'm going to ask in Portuguese so we can inaugurate the service.
Please go ahead.
Portanto, minha pergunta é a seguinte, Dr. Tedros. Como o senhor citou, existe um fenômeno da subnotificação e, ao mesmo tempo, o afrouxamento das quarentenas estão baseados nesses números. Portanto, será que não existe um perigo de haver um erro real para o afrouxamento dos confinamentos, das restrições, com base justamente em números que não são reais? Além disso, o presidente Bolsonaro disse que não tinha por que seguir as orientações da OMS porque o senhor não é médico. Qual é a resposta que o senhor daria? Muito obrigado.
Thank you very much, Jamil. The question is about easing lockdowns in Brazil.
Sorry, excuse me. I can't speak to the specific situation in Brazil. I know that over the last week there's been an overall increase in reported cases, but I think about 50–60% increase in reported cases, but that situation may reflect different epidemiology in different states. Brazil is a very, very large country. I think we need to look at trajectory, at the direction of travel of the epicurve, because the amount of testing is varying. Some countries, for example, brought on extra testing in the last number of weeks, and their cases have gone up temporarily, and now their cases are starting to drop. That's absolutely true. If countries reduce the intensity of testing, then clearly the number of cases will go down. So when there's stable amount of testing or an increased amount of testing and the number of confirmed cases go down, I think you can be sure that that trajectory is downwards. And we would like to see that as a sustained downward trajectory of cases. We would also like to see the reproductive number, the number of people that one person may infect, to be one or less. And there are all kinds of other parameters that need to be looked at. Each country has to look at its own context. I think we've said that a number of times. Each country has to balance lives against livelihoods. But at the same time, in doing that, be assured that in making that calculation, that if the calculation is made and then the restrictions are eased too early, you may be back in a situation where lockdowns have to be reimposed, and that again has an increased impact and potentially an even greater impact on livelihoods. So I think they're the real difficult decisions that all governments are faced with right now, and there are no easy answers, and I think we have to recognise that. Each government is dealing with a very different context of epidemiology, of expectations of communities, of the epidemiologic context. What we want to see is countries taking a step-by-step, data-driven approach that allows a country to move steadily towards a new normal, towards a new way of living that allows lives and livelihoods to return. But at the same time, not doing it so quickly that there's a rebound in cases which results in further lockdowns, which may be even more damaging to those lives and livelihoods that governments are trying to protect.
If I might supplement what Mike has said, so as he articulated, the lifting of any of these public health and social measures is not based on one factor alone. Of course, it cannot only be based on the numbers of cases and deaths reported. And I think it's worth saying that at this point in the pandemic, I think all countries are struggling right now to identify cases, and all countries are struggling to report the deaths associated with COVID-19. And that is to be expected because it is very challenging to identify all of them as you are dealing with a pandemic, as you are dealing with intense transmission in many countries. But in addition to the transmission that may be happening in the country and the numbers of cases and deaths that are identified, there's a number of other factors that must be considered, which include the ability of the country to identify the virus. So whether it's a workforce of contact tracers to help find the virus, whether it's the workforce in your healthcare facilities and your frontline facilities to be able to deal with patients, looking at the numbers of beds available in hospitals for mild patients, for severe patients. What does that look like in terms of your ability to handle an increased burden if case numbers increase again? Making sure that if workplaces are open, if schools are opened, that those places are ready to receive students again, ready to receive people back at work, where you can still manage physical distancing, where you can still manage the ability to keep people physically separated but let them work. And it requires having the entire population engaged and informed to understand that this needs to happen in a slow, measured, and controlled way. And as the DG has said and has said repeatedly, this will take some time, and this is nowhere near over. And we need everyone to be mentally prepared that we have some more to go. And that may require being more patient and having to deal with some of these measures that are difficult to deal with. So it isn't just case numbers and deaths alone. It's a combination of factors that need to be looked at so that a risk-based approach is taken to lift some of these measures.
Yeah, thank you. So I'd like to say a few words. On countries following WHO's advice, we can only give advice to countries, but one thing should be clear. We don't have any mandate to force countries to implement what we advise them. It's up to the countries to take our advice or reject it. But we give our advice based on the best science and evidence. Maybe one example is, as you remember, on January 30, we declared the highest level of emergency, global emergency on COVID-19. Based on the international health regulation, WHO can declare the highest level of global emergency, and we did that on January 30th. During that time, as you may remember, there were only 82 cases outside China. No cases in Latin America, actually. No cases in Africa. Only 10 cases in Europe. no deaths in the rest of the world, nothing. So the world should have listened to WHO then carefully, because global emergency, the highest level of emergency, was triggered on January 30 when we only had 82 cases and no deaths in the rest of the world. And every country could have triggered all its public health measures possible. I think that suffices the importance of listening to WHO's advice. And then we advise the whole world to implement a comprehensive public health approach. And we said, find, test, isolate, and do contact tracing, and so on. You can check for yourselves. Countries who followed that are in a better position than others. This is fact. So again, I will come back. I can give you many examples, but I don't want to take much of this time because there are many people who want to ask additional questions. But one thing I would like to repeat is, I assure you that WHO gives the best advice we can based on science and evidence. It's up to the countries to reject or accept. But from our experience so far, what we have seen is some countries accept, some may not. At the end of the day, each country takes its own responsibility. And I repeat, we don't have any power or force to enforce our advice except the willingness of the countries to accept or reject. So I hope that's very clear for any country. For any country. But one thing I would like to assure you is we will continue to give advice based on science and evidence. And then it will be up to the countries whether to take it or not. Thank you.
Thank you very much. Next question is from Antonio from EFE News Agency. Antonio, can you hear us? Antonio, just to remind everyone, you need to unmute yourself to be heard here. So if you can unmute yourself and then ask the question.
Gracias, Tariq. Mi pregunta es sobre la iniciativa ACT Accelerator que la semana pasada lanzó la OMS, en la que participaron numerosos líderes mundiales, aunque fue destacada la ausencia de líderes de gobiernos como Estados Unidos o China, que son precisamente dos de los países donde parece más avanzada la investigación de vacunas y tratamientos contra la COVID-19. Entonces, mi pregunta es si la OMS teme que estos dos países en el futuro no compartan los avances que pueda haber en este sentido y que China y Estados Unidos se distancien un poco de la OMS. Muchas gracias.
Thank you very much, Antonio. The question is about a vaccine initiative and absence of some countries.
Yes, no, thank you. The absence of some countries, we haven't invited all countries. We have invited countries who have some regional leadership. For instance, we have invited Saudi Arabia because it's the G20 presidency. And we have invited Germany because it's going to take over in June the leadership of the EU Council. And we have invited Malaysia because it's the chair of ASEAN. We have invited South Africa because it's the current chair of the African Union, and on and on. Of course, there are some exceptions like France and UK, it's because they were in the initial negotiation, and these were the countries who have started the discussion at its infancy, and also the leadership they have given until the launching of the initiative. But if you take the countries I have just mentioned, they were invited based on their role in their respective regions, because we cannot bring all countries. So China didn't participate, or others, because of the same reason. Thank you.
If I can just add to what the DG has just said, WHO works with a number of, through our expert networks and groups. And our expert networks have been working since the beginning of January on diagnostics, on therapeutics, on vaccines for COVID-19. And these experts come from all over the world. We have almost 1,000 experts today coming from all of these countries that are working on things like animal models, standardization of assays, what are the ideal characteristics for a new vaccine, the design of clinical trials for both drugs and vaccines. And as you know, the Solidarity trial is now enrolling in 11 countries, but we have over 100 countries, actually, that have expressed an interest and are in some process of joining. And this shows that this is really a global trial. We have 1,600 patients already enrolled, and we hope to now recruit patients in many countries very, very rapidly. As new vaccine candidates are developed, we hope that the same global collaboration will continue in the development, in the testing, and most importantly, in the access to these vaccines. Doesn't matter where in the world it's developed. There are over 100 candidates currently, which are at some stages of preclinical development. 7 candidates have gone into human testing. We hope that of these 100, at least a few will prove to be safe and efficacious against COVID. And it's in the interest of all countries to collaborate today, because we don't know which vaccine is going to be successful. And we have to ensure that people everywhere in all countries have access to the vaccine. Thank you.
Thank you very much, Dr. Tedros and Dr. Swaminathan. We will go to the next question. And again, I will ask when I call a journalist to unmute themselves. So it's Dawn Kopetsky from NBC. Dawn, can you hear us?
Yes, thank you. Can you hear me?
Yes, please go ahead.
Thank you for taking my question. Dr. Tedros, a few weeks ago, you had said that America was doing a great job in fighting the coronavirus. On Thursday, President Trump said that he asked whether or not injecting disinfectants into the body would help kill it. There are states that are reopening reopening services, even though there's no contact tracing in virtually any state in the United States, and we're about to hit 1 million cases. Can you tell me if you still think the United States is doing a great job? And if so, what is it that the U.S. is doing well? And what is it that we're not doing so well?
Thank you very much for this question.
Thank you. I think the United States is dealing, as it has been for a while, what is a complex situation.
Je crois que depuis quelque temps, les États-Unis font face à une situation assez complexe. Le pays est grand, 50 États avec des populations différentes, un niveau d'organisation différent selon les États, et l'épidémie a une évolution différente également selon les endroits. Le système fédéral et les gouverneurs travaillent de concert pour aider la population américaine à traverser cette crise difficile. Dirigeants de la santé publique donnent également des conseils pour éclairer les politiques. Et nous espérons que des politiques rationnelles seront mises au point. Mais le gouvernement aux États-Unis dispose d'une infrastructure magnifique en matière de santé publique et est capable de gérer sa propre transition de mesures de santé publique et sociale à d'autres mesures plus assouplies, en trouvant un équilibre entre les problèmes socio-économiques liés à la Covid et la vie économique et personnelle des citoyens. Ce que nous pouvons dire, c'est qu'il y a un plan national, je crois qu'il a été énoncé très clairement, il y a un plan progressif pour un démantèlement progressif des mesures sociales et économiques et de santé. Ce plan repose sur un certain nombre de paramètres, notamment déterminés par les capacités des systèmes de santé publique. Alors après, il y a le processus de décision qui intervient, mais le cadre existe. Si ce cadre est recommandé au niveau fédéral par des scientifiques éminents, et bien de toute évidence, c'est aux États de discuter de la façon de savoir comment le mettre en place au mieux possible. Mais j'ai l'impression que ce plan repose sur des données scientifiques. Et ensuite, il devra faire l'objet d'adaptations au fur et à mesure. Et nous pensons que le gouvernement américain et la population américaine pourront quotidiennement adapter ce plan et le mettre en œuvre en trouvant des solutions efficaces et positives qui réduisent l'impact sur la vie de la population américaine. Merci.
Thank you very much, Dr. Ryan.
Merci beaucoup, Dr. Ryan. Azerbaïdjan. Kamran Kassimov.
Kamran, unmute yourself, please, and
Est-ce que vous pouvez enclencher votre micro?
Do we have
Can you hear me?
Yes,
Can you hear me?
Yes, please.
Okay. Greetings from Azerbaijan, from Real TV. Thank you, Mr. Tariq.
Bonjour, monsieur.
Exactly, Azerbaijan following advices of WHO and some of the special quarantine regime restrictions have been lifted since the 27th of April in Azerbaijan today. And some of places, photo studios and another shopping, mini shoppings now open, but big malls and another places, I mean cinemas, theaters, schools, exactly, not open this time. Please.
Ne sont pas encore ouverts.
Many experts say about the second wave of coronavirus in Azerbaijan. What do you think about that? If it is possible, Mr. Tedros, I want
J'aimerais savoir, Monsieur Tedros, si c'est plausible et envisageable. J'aimerais connaître votre réponse. Merci. Le Dr. Ryan va vous répondre. Je sais que la situation épidémiologique en Azerbaïdjan est stable. 1600 cas à peu près et 21 décès signalés jusqu'ici. Et l'augmentation par rapport à la semaine dernière est de 18% environ. Donc la situation épidémiologique est assez stable. Et comme d'autres États dont la situation se stabilise, l'Azerbaïdjan cherche à lever les mesures. Mais il y a toujours un risque. Au fur et à mesure que nous écartons des mesures de santé publique et des mesures sociales. Comme l'a dit le directeur général, ces mesures ont dû être mises en place supprimer pour contrer une situation qui se détériorait très rapidement dans les pays. Et le gouvernement et les habitants ont réussi, grâce à ces mesures, à endiguer parfois la pandémie dans leur pays. Maintenant, le défi, c'est comment déconfiner, comment mettre en œuvre une stratégie de sortie qui n'aboutit pas à un rebond qui pourrait se traduire par une deuxième vague. Et cette vague peut intervenir maintenant, ou dans un mois, ou dans 2 mois. Nous ne savons pas ce qui va se passer dans 3, 4 ou 5 mois. Où l'on peut assister à une réapparition de la maladie. Nous ne savons pas. Ce que nous savons, en revanche, c'est que si les pays lève ces mesures, s'il relâche la pression, parce qu'il est vrai que ces mesures de confinement ont créé une pression extrême. Elles ont empêché le virus de trouver des vecteurs. Donc vous faites pression sur la capacité du virus à survivre. Donc si vous relâchez cette pression trop rapidement, le virus peut rebondir. Et nous ne savons pas à quelle rapidité et nous ne savons pas exactement quelles sont les mesures qui permettront une stratégie de sortie réussie. Nous savons par exemple que les rassemblements de masse à grande échelle ne sont pas une bonne chose. Ce que demandent actuellement les gouvernements, c'est peut-on ouvrir des écoles? Est-ce que l'on peut rouvrir une partie de notre économie avec les services essentiels, les travailleurs de la construction, etc. Donc chaque pays doit voir ce que sera l'impact positif sur l'économie de cette ouverture, mais en envisageant également les répercussions négatives en cas de rebond si on relâche la pression. Et puis il faut voir également la situation entre population urbaine et population rurale. Bon, il y a des populations vulnérables également au sein d'une société. À partir de Genève, de l'OMS, on ne peut pas prescrire à chaque pays ce qu'il doit faire exactement. Chaque pays doit adopter une approche progressive fondée sur des données et remplacer les mesures de santé et sociales qui sont levées par un pacte social qui s'assortit de mesures de santé publique très fortes comme la surveillance, le traçage des contacts, la quarantaine, l'isolement, etc., comme l'a dit le directeur général. Et il faut un investissement très fort dans le système de santé. Si la maladie revient, ainsi le système de santé ne sera pas soumis à la même pression qu'auparavant. Donc ce sont des exigences auxquelles il faut satisfaire pour assouplir si l'on ne veut pas se retrouver face au danger d'une deuxième vague. Mais c'est chaque pays qui doit voir quels sont les enseignements qu'il peut tirer de cette situation. Et je suis sûr que ces enseignements sont partagés entre les pays. Il y a quelques jours, le directeur général et les États membres, 6 États membres, en fait, ont présenté les enseignements tirés de leur expérience. Le contexte était très différent. Parfois, ces pays ont fait des choses tout à fait différentes. Et ces pays se sont écoutés les uns les autres en expliquant, voilà, nous avons fait ça, le résultat était celui-ci. Et c'est ce type d'échange, d'expériences et de leçons qui nous permettra de nous en sortir avec succès. Merci, Mike. J'aimerais ajouter quelques mots. Deuxième vague, comme l'a dit Mike, nous pouvons en fait éviter si nous ciblons nos interventions en nous concentrant bien sûr sur la santé publique. Et je vous renvoie à tous les renseignements détaillés qu'il vous a donnés. Mais ce faisant, je ne pense pas seulement aux interventions nationales. Il faut également une cohérence au niveau régional, au niveau mondial. Il faut une solidarité, c'est très important. Si l'on prend l'Azerbaïdjan, je me rappelle la réunion régionale que l'Azerbaïdjan a organisée, accueillie récemment, à laquelle j'ai eu le plaisir de participer. Il y a des pays de la région qui ont décidé de travailler ensemble pour lutter contre ce virus. Et c'est très important. Et pas seulement ça, l'Azerbaïdjan a donné également 5 millions de dollars pour financer la riposte mondiale. Donc je vois un engagement très fort de la part du président pour la riposte nationale, mais le président travaille également avec les pays voisins pour mettre au point une riposte régionale, pour faire front commun et contribuer ainsi à la riposte mondiale, que ce soit sur le plan financier ou par d'autres moyens. Donc j'aimerais saisir cette occasion, en fait, pour remercier Son Excellence le Président de la République d'Azerbaïdjan, compte tenu des 3 niveaux qu'il essaie de soutenir. Aujourd'hui, nous avons également
commitment to
un
global
autre
solidarity,
engagement en faveur de la solidarité mondiale de la part de la Lettonie, qui a contribué financièrement à la riposte mondiale. Et je saisis cette occasion à nouveau pour remercier le gouvernement letton pour son engagement. Et j'aimerais vous informer que la riposte de la Lettonie est également très rigoureuse par rapport à la Covid. Et ce qui se passe au niveau national apporte vraiment des résultats en Lettonie. Mais dans le même temps, le pays participe à la riposte mondiale, ce que nous apprécions grandement. Merci beaucoup, Lettonie.
One additional point I wanted to add to what Mike and DGs have said is about this question around the second wave, and as the Director General has just said, it's in our hands. But we are learning about this virus every day. And while one of the important things that we are starting to learn now is the extent of infection in countries. And some of this comes from the surveillance, which is detected through the PCR testing. But there's an additional tool that we have, which is gathering information about the extent of infection through seroepidemiology, which is measuring the extent of infection in people who may have been missed through surveillance, and we detect the antibody levels in those individuals. And while I don't have specific details about Azerbaijan, we are learning from a number of countries that early results suggest that a large proportion of the population remains susceptible. And that's an important feature because that means that there still are people that this virus can infect. And so in addition to how we intensify the measures to increase, the so-called lockdown measures, as well as lifting those in a controlled and studied way, it's really important that we remain vigilant, to identify cases very, very quickly through all of the systems that we have been describing. And that early action, again, even if countries have been successful in suppressing transmission, it's important that they remain vigilant to be able to detect those quickly and stamp it out right away. So these seroepidemiology studies have been very important. Even though they're early, even though there are some limitations with these studies that have come out so far, it's important that we understand at this point in time, 4 months into a global pandemic, a large proportion of the population still remains susceptible.
Thank you very much. So this was answered to Kamran Kasimov from Azerbaijan, and now we will go to South Africa. It's Dennis from Network 24 TV. Dennis, can you hear us? You would need to unmute yourself. Please, Dennis, go ahead.
My question is for the Director General of the WHO. Director, I would like to know what is the stance from the WHO on South Africa and how South Africa is handling this pandemic? Thank you.
Concernant la manière dont cette pandémie est gérée en Afrique.
I'm sure the DG will want to supplement.
Merci Denis, je vais répondre et le Dr.
Discussing this earlier today. I think there are a number of things. I think one is South Africa has, I think, used its initial lockdown very well and put in place a 4-point plan for preparedness and response. I think the deployment of 39 mobile laboratories all over South Africa has been a huge innovation. I think the training of up to 30,000 community health workers for doing contact tracing, testing and other things. I also believe that South Africa is tracking closely the HIV positive population and actively looking to see if there's any differential impact on that population, which I think is very prudent and it shows a very caring approach for a vulnerable population. Obviously, like in any country, South Africa is a large country, extremely diverse, and the disease has not yet reached the whole population, and there are large numbers of vulnerable people in South Africa. So South Africa, like every country, is not out of the woods, but South Africa was the first country in Africa to develop its own capacity to do laboratory testing, and also has given that gift to the rest of Africa through the training it has run with the Senegalese Institut Pasteur Lab and others. So South Africa is a net contributor to capacity building in Africa. And also because South Africa is will enter into the influenza season fairly soon with countries like Argentina, like Chile, like Australia, it's really important that we support countries in the southern hemisphere who do experience yearly influenza cycles to ensure that they have the capacity to both manage and monitor both influenza and COVID-19 at the same time, because I believe the lessons that are learned in the experience those countries will have with potentially both diseases circulating at the same time will not only benefit their countries, but will greatly benefit countries in the northern hemisphere who may face the same situation in 6 months' time. So we have a huge benefit to gain from investing in the capacities, the scientific, epidemiologic and other capacities in South Africa, which have been demonstrated already to be very strong. But I'm sure, as I said, that every country faces its own challenges, and I'm sure the lockdowns have not been easy for communities, particularly those in poor and vulnerable settings. But I hope I can say this without fear of contradiction. I think South Africa has really shown the way in Africa, and it's showing the way globally for how a country that has facing its own economic and other difficulties has clearly demonstrated a very strong public health-led response to this pandemic. But still, nobody is out of the woods yet.
Thank you. I have been following up developments in South Africa. And one thing that we need to underline is its community, based approach, and the deployment of community health workers. That's one. And the other is, on the risk-adjusted strategy on COVID-19. I got the information that there are now like 69,600 emails received from citizens, their comments, their inputs. I think this type of listening to communities, listening to their concerns, listening to their inputs can really help. To defeat COVID-19, the solution is making it everybody's business. And that's why, as WHO, we have always been saying, please break the barrier across party lines, come together, whether you're in the left, right, or in the middle. This is about saving the lives of your people. So just unite as one. No party lines should really divide you. And listen to your communities. Listen to the citizens, get their inputs on how to fight this outbreak or this pandemic. That's the solution. And truly, this kind of consultation with the community that South Africa is doing is very, very important. So please continue doing that, listening to your people, getting inputs from them, understanding their concerns, and all political leaders joining hands, working together to defeat this virus. So it's not an easy thing. I'm not saying it will be easy for South Africa, but the community-based approach, listening to the community and getting input from the community will really help. Whether it's getting emails like the 69,000 emails or other ways of inputting, getting their advice from the communities is very important. Our communities know the problems, know the root causes of the problems. They also know the solutions. Let's listen to our citizens. Let's listen to our people. Let's make this fight truly community-based.
Thank you very much. Next question is from Ankit Kumar from India Today. Ankit, can you hear us?
Yes, I can hear you. Good evening. My name is Ankit Kumar. I represent India Today. My question is, in India, scientists from 2 institutions have claimed that high fatality rate in some of the cities could be possibly linked due to a L-type strain of the virus. is there any evidence to show that the fatality rate is higher in this particular L-type strain? If you could please talk about it. Thank you.
Thank you for that question. So there are a number, we're working with a global network of virologists and laboratorians across the world that are looking specifically at the sequences of the viruses that are circulating around the world. And there are more than 10,000 full genome sequences available. I don't even have the last count, but at least 10,000 full genome sequences that are available. And we're looking at the changes in the virus to see if any of those changes mean that the virus has mutated and that it changes in terms of its transmissibility or its ability to infect people or its ability to cause severe disease. And so far, this virus is relatively stable. There are changes in the virus which are expected in RNA viruses, but these changes are within the expected range, and there aren't any differences in the viruses that have been found in different countries that suggest that it behaves differently in terms of its ability to transmit or its ability to cause severe disease in people.
Thank you very much, Dr. Van Kerkhove. Now we go to Tania Valbuena, N+1, that's online science magazine for Latin America and Spain. Tania, can you hear us? Maybe you need to unmute yourself, Tania Valbuena.
Hola.
Hola. Please go ahead.
Perfecto. Bueno, mi pregunta va especialmente con la notificación que hicieron el viernes de los pasaportes de inmunidad que algunos países están realizando. ¿Qué evidencias científicas aún se necesitan para corroborar si esta información es pertinente en este momento de la epidemia y qué otras acciones deben hacer estos países para reactivar sus actividades?
Thank you very much, Tanya. The question is about immunity passports.
So I'll start, and perhaps Mike or DG would like to supplement. So yes, there are some countries that are considering the use of a passport or a certificate, which would indicate that somebody has been infected with COVID-19 and has developed some immunity. And so what we're doing is we're working with labs to understand how these serologic assays are being used in individuals and what an antibody response, which is what those tests measures, means in terms of immunity and in terms of protection. And so there are a number of studies that are underway to look at the tests themselves to see if they actually do what they say they do. And what we're finding is that individuals who develop an antibody response is developed about a week or two after infection. And we're trying to better understand what that antibody response means. Right now, there are no studies that evaluate the antibody response as it relates to immunity. So we can't say that an antibody response means that someone is immune. Having said that, there are a number of studies underway, and we expect this is a very active area of research. We expect people that are infected with COVID-19 to develop a response that has some level of protection. What we don't know right now is how strong that protection is, and if that's seen in everybody that is infected, and for how long that lasts. And so right now, at the present time, 4 months into this pandemic, we're not able to say that an antibody response means someone is immune. Saying that there's no evidence in this area doesn't mean that there's no immunity. It just means that these studies haven't been done yet. And so we're working with scientists all over the world, with our partners, to really understand what this means for people who have mild disease, for people who have severe disease, and what the antibody response means in terms of protection.
Yes, and if I could just add to that, I mean, the serologic tests, or the blood test that test whether you've had the infection, to a greater or lesser extent of accuracy, can say you've had this infection. It's a very different question to say, are you protected from another infection? So one tells you, yes, you've had the infection. The scientific question is, to what extent does having had that infection offer you protection against another infection? And that is the question that still needs to be addressed. empirically, we assume some level of protection from having had an infection. If you are a healthy individual that fully clears the virus from your system, you recover, you develop antibodies. In most cases, you would expect those antibodies to provide you with protection for a period of time. The question is, it is unknown what that period of time is, and it is unknown what the extent of protection is, and that needs to be studied. There are also, and just to be clear, countries are considering different kinds of documentation. One piece of documentation is a documentation for someone who's leaving hospital as they go back into their communities that allows that person to say, I've been in hospital and I've completed the treatment course and I've now tested negative. Those kinds of documentations can be very helpful for reintegrating people back into their communities because sometimes there can be distrust. We've seen this with other diseases. So when a hospital issues a discharge letter or a note to a person to say, you've completed the treatment, you are no longer sick, and we've tested you negative for the virus, that can be a helpful document for anyone going home and reintegrating with their family and friends. I think that's different to the concept of an immunity passport or a document that says you've been previously infected. And I think there needs to be, a very detailed debate on all of this documentation, what it's for, and what is the purpose of the documentation, and then what is it going to be used for going forward. And I believe that debate is ongoing. It's a healthy debate. It needs to be had. But again, it must be driven by science. If this gets distorted, then it could be very misleading. So we need to have a scientifically informed debate on what the use of such documentation and such testing will be. And I hope that that happens immediately, sooner rather than later, and we can all get the answers that we need.
Thank you very much, Dr. Ryan. I think we have an issue with the links, but I will ask one final question that I received from email, and that's from Monique Al-Faizi from France 24. And then the question is about the importance of global solidarity in developing vaccine and the possible impact of the U.S. Acting alone. I think we already touched upon the question, but maybe Dr. Swaminathan wants to add about the importance of global solidarity in developing vaccine. If the question has been answered and we have technical issues, then we will conclude this press briefing here. We will have an audio file available. We apologize to all journalists who have not been able to ask the question, but we will see you again on Wednesday. Thanks to all interpreters who were with us today from 6 US languages plus Portuguese. Have a nice evening.
Okay, thank you. Thank you, Tariq, and see you on Wednesday. Thank you. Thank you for joining us.
Suddenly, It seems everything around us has been turned upside down.
What can people use in terms of their faith in order to get through these very difficult times?
The main thing is you're not standing there alone.
And our new normal is something we're all trying to figure out.
10,000 people with medical experience have stepped up to volunteer.
So we're saying we're all in this together. It's incredible, Mola.
Now, we need a place to turn to.
Dr. Jerome Adams, how soon could we have a therapeutic in the hands of our caregivers?
For answers.
Should we be advising people to wear masks?
Great question. Truth.
Joining us now for an exclusive interview is the Secretary of Defense, Mark Esper. Let's get to that urgent situation aboard the USS Theodore Roosevelt.
And to make sense of our world.
We're all trying to learn something during this crisis.
We're all in this together. I mean, you got to help each other out, no matter what.
He's got it right.
The CBS Evening News with Nora O'Donnell on CBS.
Go to the ends of the earth.
Right now.
We got something crazy. And reach for the stars.
Here we are.
Time.
Yes, it's my comeback.
Hey, this is pretty fun.
But wait, there's more. Experience thought-provoking.
Welcome to the idea of being a human being.
Innovative and truly original reporting.
Look through a telescope and go, wow.
Because there's always something new under the sun on CBS Sunday morning.
In times of uncertainty,
Dr. Fauci, it does seem like so much of this we're making it up as we go along.
when you have more questions than answers,
Does flattening mean that we'll soon see a decrease, or does it suggest there's a plateau?
Well, that is a great question.
there's one voice you can turn to for
We
truth,
want to turn now to the important issue of mental health.
understanding,
How do we socially distance without emotionally distancing ourselves?
and making sense of our world.
We are all in this together.
The CBS Evening News with Nora O'Donnell on CBS.
The last victim from a Walmart shooting in El Paso last year has died. Guillermo Memo Garcia was clinging to life at a Texas hospital since the August 3rd shooting that killed 22 others. He was one of the coaches of a girls' soccer team fundraising outside of the store when the gunman opened fire. Federal prosecutors have described the attack as an act of domestic terrorism targeting Latinos.
More bad news linked to that same Walmart mass shooting. A man who played a huge part in honoring the victims has been diagnosed with terminal cancer. Greg Zanis founded Crosses for Losses and traveled nearly 2,000 miles from Chicago to place handmade crosses at the site. He's been laying crosses at mass shooting venues since the Columbine high school shooting and has put more than 26,000 of those at memorials across the U.S. A Virginia teen is pitching in to help essential workers on the front lines of the coronavirus pandemic. 14-year-old Mealy Cronin started a GoFundMe page to raise money to buy food from local restaurants to give to essential workers. She raised almost $6,000. Cronin says she hopes to unite people during this difficult time and to help those in need. Like that.
Several thousand IRS employees have been called back into work to deal with a backlog because of the coronavirus outbreak. The agency called back 10,000 workers for mission-critical work that must be conducted in person. This includes helping taxpayers with stimulus checks and other functions related to the tax filing season. Now, the filing deadline this year was pushed to July 15th because of the pandemic. Meantime, those workers have been asked to bring in their own face masks. Well, a group of California businesses is suing Governor Gavin Newsom over the statewide lockdown. Their attorney says that the stay-at-home orders are unconstitutional and hurting businesses across the board, and argues that they should be lifted. He also is calling on a federal judge to have state and county governments pick up the tab for losses. Now, this is just one of several lawsuits being filed amid the coronavirus pandemic. So to break all of this down, we want to bring in CBSN legal contributor and former assistant U.S. attorney for New York's Eastern District, Keir Dougal. Really good seeing you, Keir, because it's been a long time. The lawyer representing the businesses says that the government is violating the 5th and 14th Amendments. Do they have a case?
I think they have a steep uphill climb here, and I expect that most of these claims will be dismissed. So the government has the authority to curtail rights in response to compelling public interest needs like a pandemic here. And the question is going to be how well the remedy that the government uses, how well it fits to address the problem. One of the questions, as I think we see litigation like this in the courts, one of the questions that we're going to be watching to see is how demanding the judges are in requiring that the solution to the problem be fitted to the problem itself. Can government actors, government officials, can governments use one of several reasonable approaches, or are they going to be required to use the most narrowly tailored and specific solution to a given problem? This lawsuit also faces another hurdle, which is that government officials like Governor Newsom and the other officials that are named in the suit have qualified immunity for their discretionary acts and their when they're implementing policy and making judgment calls, as long as they're not violating clearly established rights, they're going to have immunity from damages lawsuits like this.
Here, on the flip side, and it's good to see you, my friend, there's been some apprehension to some states allowing businesses to reopen despite the lack of widespread testing. So here's my legal question for you. Could a business be liable if a customer gets sick inside their location?
Vlad, it's good to see you and Anne-Marie as well, too. It's been too long. And the answer to that question is yes. The hard question, though, for lawyers addressing these issues is going to be proving causation. And it's going to be a state-by-state issue. The law of the individual states is what's going to govern. So if a customer comes into a business and then later becomes infected with coronavirus, the immediate question is going to be, was that infection caused by the trip to the business, or was it caused because of all of the other things that we do, even under social distancing and under perhaps curtailed activity that we're all observing or are being asked to observe? So there's going to be a difficult question of causation in all of these cases, given that you could potentially become infected with the coronavirus just by going outside. Businesses will be liable for what the legal term is called a tort. That's the theory, things for injury, for negligence, wrongful death. Depending on state law, businesses may be able to defend or offer defenses to lawsuits by customers for the customer's contributory negligence. They're not wearing a mask. Customer is not observing safe behaviors, social distancing in the store. There's a theory called assumption of risk under tort law, where if a business could say that the customer knew of the risk and voluntarily undertook it, that could be a potentially full or partial defense, depending on the state. But the short answer to your question, Vlad, is yes, businesses can be sued. Whether they'll be successful is another question, but it is something that all business owners are going to have to consider, even if government officials say it's okay to reopen. That's a separate question from whether or not it is wise to do so and whether or not they're creating liability for themselves by doing so.
All right, so that's a business. In Wisconsin, health officials there say that 40 people tested positive for COVID-19 after the state had in-person elections earlier this month. We already knew at that point that we were dealing with a highly contagious virus. Social distancing was being practiced all across the country. So given what Wisconsin knew about the virus, could the state be on the hook in any way because these people got sick, because the state allowed in this in-person election?
So that's a great question. And the short answer is it depends. It's possible that they might, but so lawsuits against governments themselves, as opposed to government officials, are treated a little bit differently. Ordinarily, you would need to file a claim, an administrative claim, with the government before you would go to court. And these rules vary state by state. For our viewers out there, if you believe you've been injured by a state action and you're considering this, you should know that you probably will need to move very quickly. There won't be a lot of time to file a claim like this. You'll file this claim to the state agency, and they will then have an opportunity to do something with it and agree with it or deny it. And then typically what happens is then you're allowed to go to court. The issues are, again, going to be causation. So a voter, to use the example in Wisconsin, who got sick after voting, the question is going to be, well, was it the fact that they were standing online to go to the polls that caused them to be sick, or was it something else? Was it when they went to the store or when they were at work? So there's a causation question at the bottom of this. Also, there's another, similar to the qualified immunity question, the governments have a defense of sort of discretionary acts here as well, where the government action is one where they're implementing a policy, using their judgment about what should be done. That is typically a defense. So the answer here is it depends. It's a state-by-state issue. I think these claims will be difficult to make, but it is possible if a state does something, perhaps in a context other than an election or somewhere else, where they do something that's not smart, not taking steps to protect people, and do so in a way that's egregious, that a claim like this could survive.
Keir, we've got just a few minutes, less than a minute, in fact, to talk about this, but I'm really curious. It's something Anne-Marie and I have talked about. We've seen across several states people protesting stay-at-home orders. And I'm curious as to what the legalities are when it comes to stay-at-home orders. Or, for example, people who go into a playground after the city or the community has deemed that that playground is off limits because they don't want people getting sick from COVID-19, and people defy that order. You've seen people getting arrested. A lot of people complain when you see protests out there against police brutality. You know, they say people shouldn't be breaking the law, even though that is a constitutionally protected act to protest something that you believe is unjust. So what is the law when it comes to stay-at-home orders that have been implemented by state governors or even local mayors? Are you breaking the law if you go into a park that the mayor has said should be off limits because they're trying to protect people in the community?
So you, Vlad, and Anne-Marie are asking a great question, and it comes back to this issue of how narrowly tailored can a government, how narrowly tailored must a government's solution to a problem like a pandemic be? So you have First Amendment assembly rights, you have First Amendment rights to protest and to petition the government. By standing out in front of a state house. However, the government has the right to protect public health. And so the question becomes, how specific must the government's and how narrow must the government's order be to protect public health? Right now, while we don't have widespread testing and the ability to do tracing and separate people, the government's options are pretty limited, and they're sort of very broad. You have to stay away, social distancing, don't gather, those things. While we don't have the technical means to do a more narrow restriction on people, I think the government is going to have a lot of leeway to act. But as we develop the ability to be more targeted with our response to the coronavirus, the government is going to have to pull back some of these restrictions. It's a little bit of a it depends answer, Vlad, but these are questions that I expect to be fleshed out in court in various contexts through seeking to have criminal cases dismissed, and these lawsuits against officials, we'll start to see answers to these questions.
Really, really fascinating. Keir Dougal, my friend, thank you very, very much. Good to see you. As always, providing that sound legal clarity that we so desperately need. We appreciate it.
Thank you for having me. Good to see you both.
Heading overseas, UK Prime Minister Boris Johnson is back at work after recovering from COVID-19. He was diagnosed with the disease earlier this month and spent time recovering in intensive care. Johnson delivered remarks today warning against easing lockdown restrictions and says Britain faces maximum risk as the pandemic grips the entire world. The UK is set to review its lockdown measures next week.
Meanwhile, there's an alarming rise in the number of domestic violence cases worldwide, especially in the UK, where police have arrested thousands. So CBS News reporter Haley Ott is following this story from London.
You just put up Stephen.
This dramatic reconstruction of domestic abuse in Ireland is part of a government campaign to highlight a growing problem during lockdown.
I was just talking to the
Countries around the world are seeing a spike in domestic violence as victims and abusers quarantine together behind locked doors. In Britain, specialist police officers answer the calls for help.
Open the door. So he's wanted for 3 assaults on his partner and his 2 children. It's a very nasty assault, it's very high risk, and it's owed to the victim to get this person in custody.
But violence isn't the only threat they're facing. Now they have to deal with the possibility of infection.
He's telling us that he's got symptoms of coronavirus and doesn't want us in the house.
But for many, sounding the alarm isn't an option. Fiona Dwyer runs a domestic violence charity in London.
So what we're seeing is that as more women and men are trapped in their homes, trapped with their abusive perpetrators, what we're seeing is that perpetrators will be using those very frequent tactics of isolation, of coercive and controlling behaviour. What we see quite often is that telephones are smashed, computers are hacked into.
Back at the house in Britain, this alleged abuser is arrested. But as some countries begin to ease their lockdowns, Dwyer says the main hurdle for charities like hers is still to come.
Do you think it's going to get worse?
Absolutely. I mean, we are preparing as an organisation for the huge increase in demand post-lockdown. We know that our services are going to be overwhelmed.
Overwhelmed, she says, because for many, it could finally be safe outside to flee the danger at home. Haley Ott, CBS News, London.
All right, let's take a quick break. We're going to be back on the other side of that break with a whole lot more news. Stick around. We'll be right back.
Suddenly, it seems everything around us has been turned upside down.
What can people use in terms of their faith in order to get through these very difficult times?
The main thing is you're not standing there alone.
And our new normal is something we're all trying to figure out.
10,000 people with medical experience have stepped up to volunteer.
So we're saying we're all in this together. It's incredible, Mola.
Now, we need a place to turn to.
Dr. Jerome Adams, how soon could we have a therapeutic in the hands of our caregivers?
For answers.
Should we be advising people to wear masks?
Great question.
Truth.
Joining us now for an exclusive interview is the Secretary of Defense, Mark Esper. Let's get to that urgent situation aboard the USS Theodore Roosevelt.
And to make sense of our world.
We're all trying to learn something during this crisis.
We're all in this together. You got to help each other out, no matter what.
He's got it right.
The CBS Evening News with Nora O'Donnell on CBS.
Go to the ends of the earth.
Right now.
We got something crazy. And reach for the stars.
Here we are.
Time.
Yes, it's my comeback.
Hey, this is pretty fun.
But wait, there's more.
Experience thought-provoking,
Welcome to the idea of being a human being.
innovative, and truly original reporting.
Look through a telescope and go, wow.
Because there's always something new under the sun on CBS Sunday morning.
Now on to some other news. House Speaker Nancy Pelosi has officially endorsed Joe Biden for president.
Joe Biden for President of the United States because he will be an extraordinary president. He knows how to get the job done. When our nation faced the Great Recession, It was Joe Biden who
The pre-recorded announcement comes days after more than 200 black women signed an open letter to Biden urging him to choose a black woman as a running mate. CBS News political correspondent Ed O'Keefe has more on that race.
Joe Biden knows a thing or two about being number two.
The next vice president.
And knows exactly what he's looking for in a running mate.
That they could be president. And the public look at that person and say, she is capable of being president of the United States tomorrow.
Biden's list is expected to include a mix of governors and lawmakers, many of whom aren't shying away from the speculation.
If he asked you to be his running mate, would you say yes?
Yes.
I'm honored to be considered.
My mission is to say out loud, if I'm asked the question, yes, I would be willing to serve.
Only 2 women have ever been asked to run for vice president, and neither helped their party win the White House.
Geraldine Ferraro of New York.
In 1984, eager to shake up the race, Democrat Walter Mondale chose New York Congresswoman Geraldine Ferraro.
If we can do this, we can do anything.
And in 2008, Republican John McCain asked Alaska Governor Sarah Palin to be his partner.
You know, they say the difference between a hockey mom and a pit bull? Lipstick.
Biden says he plans to announce his choice by July. He's already facing significant pressure to pick a woman of color. Amy Allison, founder of She the People, a group that promotes minority women in politics, argues that Biden can win by picking a black woman and boosting minority turnout.
This is a kind of strategy that Joe Biden and his campaign need to keep in mind and have a woman of color on the ticket. I think it would be a fatal campaign mistake to take black voters for granted.
Like many of us, Biden is stuck working at home, campaigning and fundraising from Delaware. He said recently that because of the pandemic, he's concerned President Trump might try changing the date of November's election. But the Constitution says only Congress can do that. Ed O'Keefe, CBS News, Washington.
All right, we're going to talk a little bit more about this. We're going to bring in CBS News campaign reporters Tim Perry and Lecrae Mitchell. Thank you so much for joining us, guys. Lecrae, I'm going to start with you. You spoke to a number of female activists, state party leaders. Why do they think now is the time for Joe Biden to pick a black female running mate?
Great question. And it was really a pleasure working on this story because it's such an important issue. And as we reported, since 1972, for the past 12 presidential elections, when black women have voted in presidential elections, they voted for the Democratic candidate at least more than 86%, at a rate of at least more than 86%. So talk about loyalty in numbers. There you have it. And so a lot of the women that we spoke to said that it's time for black women to be able to see themselves represented in leadership, and that it's time for that loyalty to be rewarded in a sense. It's not enough anymore to just say thank you and to acknowledge it, but it's time to put black women in those key roles and in those key positions. And we actually spoke to a number of people, one of the people being the former South Carolina State Director for Beto O'Rourke, who said black women have a pulse on their communities, that they live in understanding and they come from a place of understanding. Why wouldn't you want a black woman in a top leadership role at a time where she says the Democratic Party needs someone to help it better shape its identity? And you also had Amy Allison from She the People, a large national coalition of women of color, who said that it would be a monumental mistake, quite frankly, for former Vice President Biden to not consider and commit even to putting a woman of color or selecting a woman of color as his running mate.
So, Tim, Lecrae spoke to activists and local party officials, but you've spoken to several black women in Congress. What did they tell you?
They essentially say the exact same thing that Lecrae just mentioned, that it is past time for the Democratic Party to select a black woman as a vice president. And moreover, it's past time for Democratic presidents to begin appointing black women to positions of leadership. And Marcia Fudge, a congresswoman from Ohio, said it to me best. She said that black women are the foot soldiers of the Democratic Party. And, in the last elections that Democrats failed to win, they failed to motivate their base, which she says are black women, to show up to the polls. And so they have several candidates who they say are already qualified to be the vice presidential pick, ranging from congresswomen like Senator Kamala Harris to certain mayors around the country, as well as certain business leaders as well. And so they're saying that it's, again, past time for the Democratic Party to acknowledge the achievements and the contributions that Black women have made to the Democratic Party.
You brought up Kamala Harris. She's one of the names that people have been bouncing around, as you mentioned. And you actually followed her on the campaign trail. So do you think that being VP would be something that she would entertain?
Well, given her past interview, she has not come out and directly said that she wants it, but she always says that she's honored to be considered as part of the conversation. And she's taken a slightly different approach than another Black woman who's being considered, Stacey Abrams, the former House leader in Georgia, and also the former Georgia governor candidate in 2018. And she has specifically come out and she's been unapologetic in saying that she wants the position. She says she's more than qualified for the position. And she says, similar to what a lot of the women that I spoke to in Congress have been saying, that it's time for the Democratic Party to acknowledge the contributions that Black women have made to the party. Women of color as well, but specifically Black women. Senator Kamala Harris over the weekend said in an interview that it will be important for Joe Biden to choose a woman of color. She didn't go far enough as to saying a Black woman, but she says a woman of color. But again, Senator Kamala Harris is specifically and has repeatedly said that she's focused on handling the COVID-19, the crisis. She is a senator right now, and she's got a very large state to look after. And she has been, as she said, very busy handling that crisis. So she hasn't really come out and specifically said that she wants the position, but she also hasn't said that she doesn't want it either.
Interesting. Lecrae, one of the things that I think I'm sure the party leaders in the Democratic Party are thinking about is how to capture the widest number of Democratic voters come 2020, come this election. And it's going to matter if it's somebody like Senator Kamala Harris or, for example, Stacey Abrams, because whilst they are both Black women, I don't want it, the discussion shouldn't be just about a Black woman. It should be about the person who most adheres to the party ideals for the Democrats, the things that they're most interested in, the things that they're most willing to get done, to accomplish, and who will be able to galvanize the largest number of voters to bring them to the polls. So, yes, Black woman. A lot of people in the Democratic Party agree that that's got to be a key decision for former Vice President Biden. Then the question becomes, which Black woman? And I guess I'm curious what you're hearing about the pluses and minuses of the various women that are up for consideration.
I think that if we had a mini head to our story, a mini headline, it would be, yes, I'm excited about the possibility of a Black woman, but it needs to be the right Black woman or the right woman of color. It has to be someone with experience. It has to be someone who's talking about the key issues that are important for Black women, like Black maternal mortality rates, like racial justice, like economic equality. So it's definitely not to be taken lightly that while people are excited about the prospect and think that it's definitely time, you also had that couple time and time again with, but it needs to be the right woman, because if it's not, representation may not matter if that person isn't able to, like you pointed out, Vlad, bring out the base during this time. I spoke with Georgia Democratic Party leader Nikema Williams, who also happens to be the first Black woman in that role and is the Georgia state senator. And she essentially said that that's what she saw from her point of view in 2018 with Stacey Abrams at the top of that ticket. She said what you saw is that she was able to bring out Black women and other coalitions as well. And that's the power of putting a woman of color at the ticket, is what I heard time and time again. They don't only bring out Black women, they bring out every different coalition that the Democratic Party would need in order to win in the general election. And some of the other names that came up included Val Demings. You had Stacey Abrams, as we mentioned, and then we also heard other people say women who aren't women of color, but that they think would do well representing the issues of women of color, like Senator Elizabeth Warren, she came up as we were talking. One thing that I do think is important to mention, though, is that when it came to things that these women and political leaders that we talked to said that they do not think would be acceptable, is they do not think we should have someone as a running mate who cannot connect with a diverse electorate, who cannot garner support with Black voters, and particularly with Black women voters. And so that's something that they said is key in this conversation that we can't forget. It has to be someone that has broad appeal over multiple coalitions, so that you do have a high voter turnout in the general election.
Yeah, it's a great point that both you and Tim are making, Lecrae. And look, I think for a lot of Americans, many are finally happy. There have always been qualified women to take on this role, and even that of the President of the United States since the founding of this republic. But in 2020, certainly in recent years, it has seemed actually doable, because you not only have, as you mentioned, Lecrae, qualified candidates like Elizabeth Warren or Senator Amy Klobuchar or even Gretchen Whitmer, but now you've got an enormous number of African-American women to choose from, including Marsha Fudge from Ohio and Val Demings from Florida and Stacey Abrams, who we already mentioned, or Keisha Lance Bottoms, or Kamala Harris. I mean, it's not as if people in the Democratic Party and in this country are scratching their heads going, well, who can we pick? There are tons of qualified women, and specifically qualified African-American women that, you know, would be a perfect choice should the former vice president go that route. So I'm really happy that you guys are reporting on that and talking to lawmakers and party bosses about what they think or who they think the best candidate would be. So we thank you very much for that.
Thank you.
Thank you.
Suddenly, it seems everything around us has been turned upside down.
What can people use in terms of their faith in order to get through these very difficult times?
The main thing is you're not standing there alone.
And our new normal is something we're all trying to figure out.
10,000 people with medical experience have stepped up to volunteer.
So we're saying we're all in this together. It's incredible, Mola.
Now, we need a place to turn to.
Dr. Jerome Adams, how soon could we have a therapeutic in the hands of our caregivers?
For answers.
Should we be advising people to wear masks?
Great question.
Truth.
Joining us now for an exclusive interview is the Secretary of Defense, Mark Esper. Let's get to that urgent situation aboard the USS Theodore Roosevelt.
And to make sense of our world.
We're all trying to learn something during this crisis.
We're all in this together. You got to help each other out, no matter what.
He's got it right.
The CBS Evening News with Norah O'Donnell on CBS.
Go to the ends of the earth.
Right now.
We got something crazy.
Boom.
And reach for the stars.
Here we are.
Time.
Yes, it's my comeback.
Hey, this is pretty fun.
But wait, there's more.
Experience thought-provoking,
Welcome to the idea of being a human being.
innovative, and truly original reporting.
Look through a telescope and go, wow.
Because there's always something new under the sun on CBS Sunday morning.
Now to Chicago, where there are disturbing videos circulating online showing dozens of people packed at several house parties in clear violation of lockdown restrictions citywide. Mike Puccinelli from our Chicago station has the latest.
You can't even move.
This party on 79th Street on the south side was so jammed, the young lady shooting this video chose not to even wade into the crowd on the first floor.
And I'm gonna get up at the jam if the police come.
And although we haven't seen video of police at this party, it's clear what was on the mind of police when they broke up a large party in the South Loop. Governor Pritzker hadn't seen the video when he went before the cameras, but he clearly had heard about the parties.
I would suggest that all of those people have violated not only the intention of the order that we've put out, but also they've violated the trust of their friends and family.
The governor says all it takes is one possibly asymptomatic spreader of the virus to sicken many others who will inevitably spread it to their loved ones.
I want to remind everyone that by doing that, by standing together, not social distancing, many people not wearing masks, you're literally putting everyone around you in danger. You are. they are putting you in danger, and very importantly, all of those people are putting their families and their friends who are not there with them in danger.
You know, Anne-Marie, as we've talked about, this isn't the first time we've seen things like this. We all remember back in March, the spring breakers in Miami who said, you know, if I get coronavirus, it doesn't bother me. But as Chicago Mayor Lori Lightfoot said on Twitter, quote, reckless actions like these threaten public health and risk erasing the progresses made thus far. She also vowed to hold them accountable.
All right, so still ahead, of course, we're going to be bringing you the latest on the coronavirus with live updates across the country and around the world as officials struggle to get a handle on this pandemic.
And if you haven't already, don't forget to download the free CBS News app on all your devices. You can watch CBSN anytime, anywhere, on any connected device. Here's the deal. It's free, and so is our website, cbsnews.com. We'll be right back.
Joining us now is Dr. Anthony Fauci. Should we be advising people to wear masks?
Great question.
Making sense of our world. The CBS Evening News with Norah O'Donnell on CBS. Suddenly, it seems everything around us has been turned upside down.
What can people use in terms of their faith in order to get through these very difficult times?
The main thing is you're not standing there alone.
And our new normal is something we're all trying to figure out.
10,000 people with medical experience have stepped up to volunteer.
So we're saying we're all in this together. It's incredible, Mola.
Now, we need a place to turn to.
Dr. Jerome Adams, how soon could we have a therapeutic in the hands of our caregivers?
For answers.
Should we be advising people to wear masks?
Great question.
Truth.
Joining us now for an exclusive interview is the Secretary of Defense, Mark Esper. Let's get to that urgent situation aboard the USS Theodore Roosevelt.
And to make sense of our world.
We're all trying to learn something during this crisis.
We're all in this together. You got to help each other out, no matter what.
He's got it right.
The CBS Evening News with Norah O'Donnell on CBS.
Go to the ends of the earth.
Right now.
We got something crazy.
Boom.
And reach for the stars.
Here we are.
Time.
Yes, it's my comeback.
Hey, this is pretty fun.
But wait, there's more.
Experience thought-provoking,
I'm open to the idea of being a human being.
innovative, and truly original reporting.
Look through a telescope and go, wow.
Because there's always something new under the sun on CBS Sunday morning.
How do we put this in perspective about how worried we should be?
We're going to share the newest numbers and critical information on the outbreak.
Vladimir Duthier is tracking the plight of the restaurant business. Vlad?
You've been talking to doctors. What are they saying to you about their experiences?
To partially reopen today, despite concerns by some it could cause an uptick in the number of people getting sick. At least 12 states plan to soften stay-at-home orders, going against federal guidelines. No state has experienced a 14-day decline in hospitalizations, a pivotal point the CDC recommends before easing social distancing measures. These states join Georgia, South Carolina, and Tennessee, which began allowing some non-essential businesses to open their doors last Friday. Mark Strassman is in Georgia to find out if it really is back to business as usual.
The weekend was a little slow.
Jason Griggers held what he called a soft opening at his Atlanta area salon this weekend. He served a handful of clients, his first in 6 weeks.
We're trying to stagger our clients and not just load them in here so there's not so many people in here at one time. We can practice good social distancing.
Georgia's not alone in relaxing stay-at-home orders. Elected officials are making similar decisions around the country, sometimes against the advice of public health officials.
Social distancing will be with us through the summer to really ensure that we protect one another as we move through these phases.
But with roughly 1 in 6 Americans without a job, the prolonged quarantine has shredded state economies. Some governors say it's time to move forward.
We're always going to be data-driven.
Oklahoma's Republican Governor Kevin Stitt announced some businesses like gyms and restaurants will be free to open on Friday.
The two guiding principles that I told Oklahomans we're going to use through this whole process was the health and safety of Oklahomans, number one, and then mitigate the loss to our economy and get our workers back working as quickly as possible.
That sentiment has bipartisan support. Colorado's Democratic Governor Jared Polis announced his state's stay-at-home order would end today.
What we know is that what matters a lot more than the date that the stay-at-home ends is what we do going forward. It doesn't accomplish anything if it's not replaced with practices that are sustainable for the weeks and months that it's likely to remain with us.
At least 12 states are easing restrictions on non-essential businesses like restaurants, salons, and some retailers. None has met the CDC's guidelines for relaxing social distancing rules, a 14-day decline in hospitalizations. On Sunday, New York Governor Andrew Cuomo said some businesses in his state could reopen as soon as May 15th. He called on them to think outside the box.
This is not a one-sided equation here. Businesses, you develop a plan on how you would reopen given everything we now know.
So as some states allow more businesses to open during the pandemic, the White House's coronavirus coordinator warns a full reopening is still a long way away, and social distancing may last well into the summer. The U.S. death toll from COVID-19 has continued to climb at a steady pace since March. In the past 2 weeks, deaths have more than doubled, now at nearly 55,000, as we near the 1 million mark of confirmed cases. There is no coronavirus task force presser scheduled for today, nor did President Trump publicly appear for any press conferences over the weekend. Instead, he chose to share his thoughts on Twitter. A senior advisor tells CBS News some of the president's internal aides are urging him to scale back his daily coronavirus briefings. They don't believe the pressers are benefiting him, especially in the wake of his suggestion disinfectants could be used to battle the disease. Dr. Deborah Birx took the lead for the White House's media response instead, appearing on 2 Sunday shows. As White House correspondent Ben Tracy reports, she says testing still needs drastic improvement.
We have to have a breakthrough innovation in testing.
Dr. Deborah Birx says a different type of coronavirus test, similar to those that test for flu, is needed to adequately screen the U.S. population. A so-called antigen test would more quickly and cheaply detect the body's response to the virus.
Just allows you to screen large numbers of individuals quickly.
Birx also said the White House is working with states to increase testing capacity, despite the president saying states are responsible for their own testing and bragging about the overall U.S. response.
We've tested far more than anybody else anywhere in the world.
The president is now often contradicted by his own health experts, and even some in his own party are criticizing his daily press briefings.
Unfortunately, some of the messaging has not been great.
Maryland Governor Larry Hogan, a Republican, says his state's emergency management agency was flooded with calls after President Trump said this on Thursday.
I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning?
I think it's critical that the President of the United States, when people are really scared and in the middle of this worldwide pandemic, that in these press conferences that we really get the facts out there.
After the blowback this weekend on Twitter, the president questioned the purpose of having White House news conferences, adding, "Not worth the time and effort." But it's his own comments that have forced his team to spend time clarifying, and Dr. Birx expressed her frustration with the media coverage.
Sometimes I worry that we don't get the information to the American people that they need when we continue to bring up something that was from Thursday night.
And we're going to take you live now to Arkansas Governor Asa Hutchinson with the latest on his state's response to the coronavirus. Let's listen in.
We'll elaborate on the specifics surrounding that.
And so that leads me to, with the announcements that are coming up Wednesday and later on in this week, I wanted to review the gating criteria that was set out by the Opening Up America Again phases that the White House released. And it's in this form, as you can recall, where you had the 3 different categories of gates that you're supposed to meet or criteria you're supposed to meet: symptoms, cases, and hospitals. I broke that down into 3 different charts that I wanted to go over with you, but we're taking it straight from there. But first, if you'll go and look at the simply the chart on the number of cases, is one of the gating criteria, and you can see that we're on a downward trajectory with the latest results. Of course, we had the peak that was because of the outbreak in Cummins that's being managed, but you see the downward trend with the one in the last 24 hours that looks like that's about 70 cases that we've had. So we like the way that's looking and that way that is trending. If you go to the next one, this is really I wanted to show the results of our testing surge. We had a 2-day testing surge that we emphasized, and I set as a goal that we would go from an average of about 1,000 tests up to 1,500. And so that's April 24, which runs about a day behind. You see the 25th and the 26th. On each of those days, we were over 1,500 in tests. And we're very, very delighted and want to thank all of Arkansas for if you had symptoms, go get tested, you responded, and it gives us a better sampling as to where we are in the state. And I want to thank the hospitals and the clinics that really emphasized this over the last couple of days, last 3 days. And so we met our goal on that. We exceeded the 1,500 and very pleased with it. If you go to the next slide, this is just an itemization. This starts through the gating criteria. And the first gating criteria that we're supposed to satisfy before proceeding to phase 1 opening. And the first criteria is on symptoms, which is a downward trajectory of influenza-like illnesses, which is the ILI reported within 14-day period, and a downward trajectory of COVID-like syndromic cases reported within a 14-day period. And so those are the first category. Let's go to the next slide. Let's see how we're doing on this. And so this is that, this is the essence, which is the percent of daily emergency room visits for COVID-19-like illness in Arkansas. And you can see from this that it starts on April 2nd, and that you see that downward trajectory for the COVID-like illnesses in Arkansas. And then the other category was let's go to the next one, which is the percent of weekly outpatient visits for influenza-like illnesses in Arkansas. And this is by week, but you can see by the week category that we're on that downward trend in that category as well. We're very pleased with those results and where we are in the state in regards to that downward trend. And then let's go look at the next category of criteria, which is cases and the downward trajectory of documented cases within a 14-day period. Now, you know that as you look at the downward trajectory, we're on a downward slope, but we haven't been there for 14 days. And that's important, and that's what they talk about nationally. Some states open up, you haven't been on a downward trajectory for 14 days. I remind everyone that there is flexibility that's given to the states, but even with that, it says downward trajectory of documented cases or a downward trajectory of positive tests as a percent of total tests within a 14-day period, flat or increasing volume of tests. And so that is something that's very important. We've talked about our positivity ratio of tests, and let's go to the next slide and see how we're doing on that. And this is the percent of COVID-19 positive tests by date of result here in the state of Arkansas. And so if we do a 100 tests and we have 10 that are positive, that's a 10% ratio for positivity. And you can see on March 10th that we had a spike that we were running about over a 30% positivity rate on tests that we were giving. And of course it varies over time because a lot of it is whether you're dealing in a nursing home environment where you have a number of positive tests, or whether you're in a prison system, or where the tests are coming from. But over time you can see that it came down to a flattened area, and then you see around April 19th it shot up again because again we had the outbreak that was in the Cummins unit. But you can see then that we've had a positive decline of our positive test, our positivity here in Arkansas, and that's on the right trend and the right trajectory. And then the last category of criteria for the moving to phase 1 is where we are on hospitals. Our ability to handle an outbreak and to provide care. And it's to treat all patients without crisis care, which means we have adequate hospital facilities, adequate ventilators here in this state. And Dr. Smith can comment on that, but without any question, we have more than adequate in both categories of ventilators and hospital beds so that all patients can be treated without having a crisis environment. And that you have a robust testing program in place, but it emphasizes for at-risk healthcare workers. So, and we've had that in place for some time, where all healthcare workers have had a priority in testing, whether it's from the Walmart and Quest partnership or whether it is from our Department of Health that has prioritized our healthcare workers. And so we've had that criteria that has been met also. Let's see, is there another slide? I think that covered those slides that I wanted to cover. And I think that really tells the story that in terms of the gating criteria that was given by the White House, it's looking positive in terms of the trends, the trajectory here in the state of Arkansas. And with that, let me turn it over to Dr. Smith for his comments.
Thank you, Governor. And I really appreciate you going through the gating criteria so people can understand what that is and then understand where we are with respect to that. I'm going to give a few more details, and welcome, Eddie. I'm going to give a few more details on the numbers. As the governor mentioned, we've had 76 new cases since yesterday. Of those, 60 were from the community, and 16 were from the Cummins unit. So as the governor mentioned, our total is 3,017. We have no new counties. Of those 3,017 cumulative cases, 316 are healthcare workers. That's 13 up from yesterday. We have 203 who are residents of nursing homes and 115 staff at nursing homes. An update from the Cummins unit, we are up to a total of 856 cases. We have only about 32 test results yet pending, so we may have a few extras, but we're almost done with testing almost the entire inmate population. We are up to 50 staff. We have about 15 pending as well, so we may have a few more. But we have tested a majority of the staff. And current hospitalized, the governor mentioned, 109 is a net gain of 2 from yesterday. Currently on a ventilator is 25, and deaths, as the governor mentioned, is 50. I want to talk briefly about our testing. As the governor mentioned, we were able to exceed 1,500 test reports for the last 2 days. Now, our 2-day surge was Friday and Saturday, but then it takes at least 24 hours to get the results back on those. We will probably continue to have some results from Friday and Saturday that are reported today and tomorrow. And I'm hoping that we will continue to exceed 1,500 for as many days as we can. In terms of our reports from yesterday, we did have 1,506 reports with a positivity rate of 1.8%, which is much lower than our average positivity rate of 7.5%. And I should also note that we have total tests for the state have been 40,074. Of the 1,506, I just need to give a shout out to the Arkansas Department of Health Public Health Lab. They upped their game. They contributed 201 to those yesterday and 254 the day before. So I think everyone's been working very hard towards optimizing our testing. And with that, I'm going to go ahead and turn it back over to the governor.
And with that, we'll be happy to take any questions. Yes, sir.
Tennessee is opening restaurants today. Yesterday they reported.
You are in the meeting now.
And yesterday they reported their single highest case increase of 478. Do you have any concerns that some of our border states might be moving a little too quickly and that could affect Arkansas?
Well, I mean, we have a close relationship with Tennessee right across the river. There's a lot of interchange, particularly in Memphis and Arkansas, but also you go up to Dyersburg, Tennessee, and a number of people that work in our steel plants in northeast Arkansas that live in Dyersburg. And so there is that connection there. So we do watch that. I know Dr. Smith is in contact with their Director of Health in Tennessee as well. I think Governor Lee has been handling it well. Of course, he opened it up, broadly in the state, but left some of their cities are handling it differently. So a little bit varied, which just simply reflects that every state's looking at where they are a little bit differently. But we watch it. Obviously, they have more cases than we do here in Arkansas. And we hope to learn both from what's happened in Tennessee, but also what's happening in Georgia. Dr. Smith and I visited with that a little bit, and I think as they open it up, we're going to be instructed in the next few days and week as to what happens in those states as well. So we do learn from each other.
Tyson officials and some other meat processors are predicting potential food chain supply shortages. Any reaction to that, or have you been in contact with them on kind of what their status is?
We have, and obviously the fact that we have, I believe it's over 60 food processing plants here in Arkansas indicates that Arkansas is critical in not just our own food chain, but the nation and the world's food chain. And so the success and the health of those workers in the processing plants are very critical. And I know that Secretary Smith has worked with those in setting up the right health guidelines, but they've really gone the extra mile in it. And their chairman had the letter to the editor, the printed letter in multiple publications across the country, just emphasizing how important their health and their processing plants are to the nation's food chain. And we haven't had any go down in Arkansas. While they've had some of them go down in other states, we've hoped that we don't have them go down in Arkansas, and if they do, we can work with them to get them back in operation quickly because they are very essential. But I appreciate the way Tyson's and some of the other companies has handled those processing plants.
Are there any specifics on what the state will do if it does get to that point? I mean, is there a plan in place, I guess I should ask?
Dr. Smith, do you want to comment a little bit on our work with processing plants? From a health standpoint, in terms of, I don't expect we're going to get there with, I think they'll stay in operation. We've got to get to the point, which I believe we are, that if there is a positive case, you're going to go in, you're going to clean it out, you're going to treat it, and you're going to be back in operation. And so I hope that's the case in Arkansas as well.
Certainly, I agree with the governor. If we do have a cluster of cases in one of the plants, then I think we already have plans in place how we would deal with that in terms, from their perspective, from the cleaning, and from our perspective, how we do the contact investigation. We've gotten a lot of experience with that recently, and we can do those fairly rapidly. We did have a small team from the health department go for a visit, not a formal inspection, and informal consultation last week, and so I think we're together on the same page, and we're impressed with what they're doing.
Yes, ma'am.
You mentioned a call with the White House at 1 p.m. Is there a specific reason for this call, or is it more of an update with the governors and President Trump? Or?
We have had regular calls with the White House once a week, if not more, and the Vice President is always, as the head of the task force, participating in it. And this call, the President will be participating in it as well. I know that we'll be talking about testing, and that capability. We'll probably be talking about funding in the debate in Congress over what the states can expect in the next round of funding. But it's not unusual for the President to engage, but and he listens. They're long calls sometimes, and gives the governors opportunity to talk about what's happening in their state. We learn from each other.
Can you give an update on how many Cummins inmates are hospitalized and how many are showing symptoms?
As of 6 p.m. yesterday, there were a total of 6 inmates hospitalized, 4 at UAMS and 2 at Jefferson Regional. I asked specifically yesterday about how many were being cared for in their field hospital, and at that time they had none. And they said they would let us know if they had any that needed to be cared for in their field hospital within the unit. In terms of symptoms, that's a very fluid, difficult number to get a hold of. The vast majority of those tested did not have symptoms at the time that they were tested, but individuals may have developed symptoms since then. So that's a bit of a moving target. I would have to have you direct those questions to Department of Corrections.
Let's go remotely. Is there any question remotely?
Yeah, Governor, this is Andrew with AP. Wanted to see on the testing surge. Wanted to see if you could break down, give us more specific numbers for each of those days, and also wanted to see if Dr. Smith had any sense of how things are going with elective surgeries resuming. If there's any sense of how many places have been able to do it, and if there's been what impact that's had on testing demand as well.
Well, in terms of the number of tests each day, we reported on April 24 a little over 1,000 tests. On April 25, there were about a little over 1,500 tests, and the same thing for April 26. You wanted the exact number, which we will be happy to provide. Do you have that, Dr. Smith? I'll let you go ahead and give the specifics and answer that second question.
Yes, I'm going to give numbers specifically. Well, I can give numbers for Friday, but realize that doesn't reflect the number of tests that were done on Friday. But on that Friday, we had 1,079 tests total with a 7.9% positivity. On Saturday, we had 1,598 tests with a 4.8% positivity. And then yesterday we had 1,506 tests done with a 1.8% positivity.
And he had another question, I think.
Was there a second question?
Yeah, the other question was how on the resuming elective surgeries, have you gotten a sense of how many places have been able to resume elective surgeries and how much of an impact that's having on test demand as well?
Yes, the directive on resuming elective procedures goes into place today, and so we don't have much experience to report back on that yet. Again, the recognition was that not every facility would be equally well prepared to meet all the criteria. Remember, elective surgery, resuming elective surgery is really a phase 1 activity that, according to the White House guidance, we wouldn't have initiated until we entered phase 1 and met those gating criteria. We put out some fairly stringent criteria, though, that we knew from the science and from other sources of experience would allow us to do those procedures on a limited basis safely. And that includes things like PPE and screening of all cases within 48 hours of the procedure. Again, not an easy threshold for all facilities to meet, but those who can, we wanted to enable them to be able to resume elective procedures on a limited basis even before we met the full gating criteria for phase 1.
Yeah. Yes.
This is Shakari with the Public Commercial in the White House Journal. Can you give us an update on the plasma donations in the state if the need is still being met?
Sorry. Can you ask that question one more time? Was it plans for donations?
I'm sorry, yes. My question is, can you give us an update on the plasma donations and if the need is still being met?
The plasma donations.
Yes, the question has to do with using plasma, convalescent plasma. This is plasma donated by people who have recovered from COVID-19 infection, and those antibodies in that plasma we think will be helpful to those who are acutely ill. Again, this is a strategy that's been used for a number of other infectious diseases successfully, and we are doing that here. We were one of the first states to set up a donation program, and we actually encourage all of those who have recovered from COVID-19 infection to consider donating plasma, because this can be hopefully life-saving. We've had a number of patients who have received convalescent plasma here in the state, hospitalized patients who are very ill, and at least the reports I've received from the physicians is a number of them have shown clinical improvement. Again, we don't have all the clinical trials data out on this, but it is a strategy that we know works for a number of different infectious diseases, and we have started to see some positive results on a case-by-case basis, but really would like to encourage those who have recovered from COVID-19 to consider donating plasma. And I don't have the numbers for the number who have donated so far or received yet, but I'll have those for you for tomorrow.
Governor, Dr. Smith, Rolly Hoyt from THV 11. Taking off a little on what Andrew's question was, what's your anxiety level today as elective surgeries begin, and in terms of how much PPE is out there, and what are you watching for as these healthcare facilities ramp up again? Do you feel like there's enough PPE out there to go around as more and more companies come online?
Thank you for the question, and I'll tackle it first and let Dr. Smith comment. But in terms of the elective procedures and surgeries that are authorized today, I mean, the first requirement is that the patient have a COVID-19 test within 48 hours, and there's been some concern expressed as to whether we can get that turnaround in time. And I know that Dr. Smith and UAMS is working on making sure that that capability is there. So we're working hard to address that, but that is something that is necessary and will give us better protection and safety, but also a better sense as to where we are with any outbreaks of COVID across the state. The second part of your question is in reference to PPE, and our supply chain continues to grow, and what we're seeing is that there's now multiple channels for that protective equipment to get to the clinics and the hospitals. It's partly their supply chain, it's partly what comes from the FEMA channels, and it partly comes from the state. And so with all of that combined, we're much more optimistic and comfortable as to where we are with the PPE.
Yes, as I think you recognize that from the beginning, we've had challenges with PPE, although that seems to be improving somewhat as supplies are a little bit more available. The FDA has also helped with categorizing some items through an emergency use authorization. For example, KN95 mask, which is a different designation in other countries. They've now, through an emergency use authorization, allowed those to be used where we would use an N95 mask, so that opens it up a little bit. We also have a PPE decontamination unit we're expecting to arrive from FEMA in the state later this week. Once that's operational, hopefully the week after, that will be an option for actually being able to decontaminate some of our PPE so it can be used more than once.
I think it was a couple weeks ago you announced that the state was sending some ventilators to Louisiana to help there. Do you know if those ventilators are still there or if they've been returned?
Actually, Governor Edwards indicated that they were in good shape, and so they were not sent because the state of Louisiana said they were no longer needed. But he called and made sure that we understood in Arkansas how much they did appreciate that willingness to send those ventilators there.
Governor, this is Drew Smith with Times Record in Fort Smith.
All right.
Would you say that this surge is ongoing, and how sustainable is it to continue increasing the number of tests that Arkansas is taking?
I think the question is how sustainable and how can we continue to increase testing in Arkansas. You're going to continue to see that testing capacity grow because of the emphasis at the national level in pushing our manufacturers, our suppliers to continue to grow that capacity and inventory. And so I'm confident that it will continue to be increasing in availability. In terms of our own testing, and Dr. Smith has helped educate me on this, he is the infectious disease expert that we're very, very lucky to have here, but you know, the focus has got to be on the contact tracing, and that's what we have continued strength and capacity in the Department of Health. And then the other testing is based upon the symptoms. And that is, as we've seen over the weekend, we have the capacity to do that. But if people don't have symptoms, they're not going to get tested. Well, if they don't have symptoms, that's a good sign for our state. And so part of that is dependent upon demand. And then the third part of it would be the antibody testing that we will bring online whenever it really gets refined to the right point. It'll be a good tool to use next year. Dr. Smith, do you want to add to that?
I agree with everything the governor has said. I think the only thing I would add to that is that through the course of the last several weeks, we've seen rate-limiting steps with regard to testing in various pinch points. Currently, probably the rate-limiting step is the availability of swabs to hospitals, clinics, other providers, and that's real, and I don't want to downplay that, but swabs are not like ventilators. They don't take that long to produce, and we will expect to see more and more of those available, and then more and more different types of swabs have been authorized through EUA, emergency use authorization by FDA for use in this way. So I think that is currently the pinch point for testing. People who say that we don't have the supplies for testing, it's mostly the swabs, but that should be corrected fairly soon.
To the table, right here. Yeah, no, just we're at the table.
Governor, do you know if Walmart and Quest Labs plan to set up testing locations at other places in Arkansas?
I do not know the answer to that. I know that initially they were looking at hot spots across the country, and they concentrated on a few states, and then they came to Arkansas and they did their first lab in Bentonville area, and then they expanded it here in Little Rock area. I hope that that is a partnership that will continue. It's very useful. It's drive-in. It gives us greater capacity in Arkansas. So I hope so, but there's not any definite plans that I'm aware of. Are you, Doctor? All right. We'll stay at the table for one more question, and we'll go remote.
In regards to the PPE and supplies, are there any other Arkansas manufacturers who have jumped onto that? I know L'Oreal was doing their thing, but do we have any other manufacturers within the state that have sort of pledged to help the state out?
I know that we have a couple of manufacturers that are looking at it, and we've been in touch with them. I know one personally in their capacity, and they would have to switch their manufacturing totally to PPE, but it's a future opportunity for them, and I guarantee you I would love to have that manufacturing opportunity right here in the States, so we're not so dependent upon the global marketplace. So we'll continue to work on that and see if, I don't have the Defense Production Act at my disposal that I can actually do that, but I know we got some good entrepreneurs that are looking at that as an opportunity. Let's go remotely for a question.
Governor, this is Lance Turner at Arkansas Business. I had another question about the food supply chain. You note that Arkansas is doing well. We've had no closures so far. Are our guidelines different from other states? Are we doing something different that maybe other states are not? And how exactly are we monitoring our food supply chain in the state? And not to just keep asking questions, but is there something missing in regards to national policy on food processing guidelines? Is there a consistency that needs to happen there, or what do you think?
Dr. Smith, I'm going to let you address that, in terms of the how our guidelines compare with other states. I know we've worked very hard on it. I think it really reflects, to a certain extent, the fact that we have those processors right here in Arkansas. They understand what's at stake, the critical nature of their work, and they're investing in it themselves. And so they're incentivized and they're doing it, obviously in partnership with the Department of Health. But in terms of also the monitoring of our food supply chain, I think every consumer monitors it every day when they go into the store, and they see where there's a shortage and not, and so we get very quick information on that. It is something to watch, and early on it was a problem because people were doing panic buying. That has subsided, and now it's a little bit more of the processing plants itself and their continued production. Arkansas is key, again, both in terms of processing, but also in terms of the transportation and the supply chain. So we will continue to monitor that, but I'm very optimistic that with our leaders here in Arkansas that it will continue to be very, very strong and reliable.
I guess in terms of monitoring more about, the worker safety aspects, because I think some of those plants across the country have had to close because of infections, and so do we routinely monitor now for COVID-19 standards in our food processing plants, or is that, how would that work, or how does that work?
This is Dr. Smith. Yes, part of that visit last week was to look at and to see what sort of worker safety procedures, protocols had already been implemented, and where there might be areas for improvement. And remember, it's not just on the plant floor. It's making sure you don't have clustering in the break areas where people who might be infected might spread to others. Another aspect of this, of course, is how much COVID-19 spread is going on in the surrounding communities. If you've got a rip-roaring epidemic around a plant, it's going to be really, really hard to keep it out of the plant. In our case, Arkansas has one of the lowest case rates per population in the country, and that helps our plants in terms of keeping COVID-19 out of their plants or keeping it contained if it comes in. I would also say that we've also been very intentional in Arkansas about trying to make sure that we are adequately reaching some of the harder to reach groups in terms of culture and language barriers. We've had a number of materials in Spanish and also in Marshallese, the language of the Republic of the Marshall Islands. We know that many of our immigrants from the Republic of the Marshall Islands are involved in the poultry processing industry. Over the weekend, we tested about 250 Marshallese, and we had 4 positive. So we are monitoring that group very closely, and at this point, does not look like we have a problem with spread of COVID-19 in that community.
Jake?
Is there any concern in just the slow uptick in hospitalizations? I mean, I get it's not at crisis level, but I know that was emphasized early on as to what the bigger picture is, but that number just kind of keeps going upward.
The hospitalizations are always going to lag a bit behind cases, and remember, a lot of our testing in the nursing homes have been among asymptomatic individuals, and so there was a bit of a lead time there where we were detecting these cases earlier than we might otherwise, and they can go from asymptomatic to symptomatic to hospitalized. So we will have to watch that carefully and see, but we will expect that eventually to start heading downward, but maybe not right away.
Is there any update on what the average hospital stay has been? I know a couple weeks ago you said it was about 6 to 7 days.
I have not done a repeat analysis on it. It's very difficult when you've got a lot of people who are still in the hospital, but we know anecdotally that some of these hospitalizations have been much longer, and especially those who require mechanical ventilation. Something that was very encouraging to me, though, was our very first case in Jefferson Regional was discharged from the hospital, released from the hospital last week.
And then I guess what's been the average for somebody who's been on a vent?
On a vent, that's also difficult because a lot of folks still are on a vent, but it tends to be weeks.
Let's do just a couple more questions. So is there another question remotely?
Yes, Governor Neil Hot Springs for Dr. Smith. The 1.8% positivity, I recognize that would call for some speculation, but so much under the other. Do you have any idea why that was? And that's good news, but why the positivity rate would be so low in yesterday's tests?
The question had to do with why our 1.8% positivity rate yesterday was so much lower than our average and what we had seen previously. I think there's a couple of reasons for that. First of all, we've opened up the criteria, so more people are being tested. In the past, we were really testing higher risk individuals, but also we've seen our outbreak at the Cummins unit, for example, is wrapping up in terms of testing, and we had a lot of testing in nursing homes previously and not as much now. So I think some of these, when we were testing in the Cummins unit in particular, we were seeing a much, much higher positivity rate because we know we had a lot of people exposed in a contained setting. I think our 1.8 is representing more what we would expect in testing in the community.
Does that mean that 7.5% overall figure included the Cummins people and the nursing home people?
It did. And also remember, our testing criteria were a lot stricter several weeks ago. We had less capability of doing testing, so we were trying to focus on those who were at the highest risk.
We're getting some reports that there was some type of cyber attack at UAMS over the weekend. Do you have any updates on that, or it impacted the hospital's ability to respond to the virus at all?
They've got it remedied, and so it was a quick turnaround by their IT department. I got notification of that, I believe it was yesterday, Sunday, and really within 12 hours it was remedied, and it did not interfere with us getting those testing results. Is there one final question? Did I hear one other person remotely?
Yes, Governor. Now Dominguez here. I would like to know if hotels, motels, and vacations rentals are in the list of phase 1 or 2 for the lowering restrictions?
The question is whether motels and lodging, those restrictions are lifted any, is that a phase 1 or phase 2? And first of all, we have limited our state park lodging and closed our state park lodges. And so there have been restrictions there. In terms of overall hotel lodging, the restrictions are on out-of-state travelers. And that has just simply been our focus in Arkansas to make sure that those from hotspots aren't coming back in here. We expect that to stay in place for some time. In terms of the phases, phase 1 is still where travel is discouraged, even as you enter into phase 1. And that's actually a good point to end today's conversation, is that as we look at the gating criteria that Arkansas is doing very well on to enter phase 1, phase 1 and the other phases still emphasize that we have to do our social distancing. We need to continue to wear masks whenever social distancing does not work. So I encourage everybody, when we talk about opening up, first, we didn't close everything down in Arkansas. We've been open for many businesses that have been closed in other states, but we will start looking at lifting some of the existing restrictions on some of our businesses. But as we do that, we're still going to continue to emphasize the social distancing and careful so that we make sure we don't have a resurgence of this virus. With that, thank you all very much today. Yeah, Eddie, that would.
And you've been listening to Arkansas Governor Asa Hutchinson with the latest on the coronavirus situation in his state. We're going to take a quick break now, but we'll be right back with much more CBSN. Don't go away.
These are hard, tiring, taxing jobs, even before coronavirus came.
This is my Clorox wipes, my Lysol. I have no idea what I'm walking into. I don't know if the customers are carriers.
I feel privileged to be out here when so many people are out of work.
Did you ever think that you would find yourselves at the front line?
We have the opportunity to bring something valuable to the community, and that feels good.
We have to be willing to change policy on a permanent basis to recognize and honor these workers.
It doesn't seem like it's worth the risk that you endure every day.
I have to do what I can to take care of myself and my family.
If you had the choice, would you stay home?
Maybe, yeah.
Oh my God, the truck is sinking.
Devastating flooding has reached catastrophic levels.
Rising sea levels are threatening America's coasts.
You would have to take that house and put it on stilts 10 feet tall. If the street is filled with salt water, what difference does it make how high you make your house?
The concentration of the highest rental rates is exactly where the elevation is highest.
This was the evidence to prove that climate gentrification was real.
Pay $1,800 in 5 days or you have to leave. Were you scared?
Yes.
Every single person who stood up and said, I am not paying this rent increase, received an eviction.
Haitians built this place and you're getting kicked out.
Yes.
In 60 years, we went from about 100,000 factory workers to probably about 7,000.
Off in the distance, you can see some factories that are still humming, but most of them are just kind of abandoned.
The restaurant industry right now is one of the largest and fastest growing industries in America. And yet it continues to be the absolute lowest paying employer in the United States.
Barely anybody's making enough to live.
You're donating plasma to get by.
It's literally a slave wage.
I don't remember growing up like this. My mom didn't have to go to food banks. It's pretty sad.
In
times of uncertainty,
Dr. Fauci, it does seem like so much of this we're making it up as we go along.
when you have more questions than answers,
Does flattening mean that we'll soon see a decrease, or does it suggest there's a plateau?
Well, that is a great question.
there's one voice you can turn to for truth,
We want to turn now to the important issue of mental health.
understanding,
How do we socially distance without emotionally distancing ourselves?
and making sense of our world.
We are all in this together.
The CBS Evening News with Nora O'Donnell on CBS. Suddenly, it seems everything around us has been turned upside down. We need a place to turn to for answers,
Dr. Jerome Adams, how soon could we have a therapeutic in the hands of our caregivers?
truth,
Should we be advising people to wear masks?
great question, and to make sense of our world.
We're all trying to learn something during this. Just saying thank you means so much.
The CBS Evening News with Nora O'Donnell on CBS.
If you have COVID-19 right now, what do these potential treatments mean for you?
There is hope, and this drug is hope personified to every person with this disease.
When could this therapeutic drug be available?
The first potential treatment we should be able to know as a scientific community within the next few weeks.
We'll see you right back here tomorrow because we're all in this together.
New data suggests a growing outbreak of coronavirus infections among immigrants in U.S. custody. ICE says at least 317 people in its detention facilities have tested positive for COVID-19. A federal judge on Friday ordered the Trump administration release all minors from the facilities after calling them, quote, hotbeds of contagion. Now, other countries are accusing the U.S. of exporting the virus through its deportation policy. CBS News immigration reporter Camilo Montoya Galvez has been following all of this closely. He joins me now from Kenville, New Jersey. Welcome, Camilo. Explain the emerging situation across U.S. immigration detention facilities, and how exactly is ICE addressing the outbreak? We're going to have to take a quick break because we are having an audio difficulty with our guest, but we will be right back with much more CBSN, so stay with us.
These are hard, tiring, taxing jobs, even before coronavirus came.
This is my Clorox wipes, my Lysol. I have no idea what I'm walking into. I don't know if the customers are carriers.
I feel privileged to be out here when so many people are out of work.
Did you ever think that you would find yourselves at the front line?
We have the opportunity to bring something valuable to the community, and that feels good.
We have to be willing to change policy on a permanent basis to recognize and honor these workers.
Doesn't seem like it's worth the risk that you endure every day.
I have to do what I can to take care of myself and my family.
If you had the choice, would you stay home?
Maybe, yeah.
Oh my God, the truck is sinking.
Devastating flooding has reached catastrophic levels.
Rising sea levels are threatening America's coasts.
You would have to take that house and put it on stilts 10 feet tall. If the street is filled with salt water, what difference does it make how high you make your house?
The concentration of the highest rental rates is exactly where the elevation is highest.
This was the evidence to prove that climate gentrification was real.
Pay $1,800 in 5 days or you have to leave. Were you scared?
Yes.
Every single person who stood up and said, I am not paying this rent increase, received an eviction.
Haitians built this place and you're getting kicked out.
Yes.
In 60 years, we went from about 100,000 factory workers to probably about 7,000.
Off in the distance, you can see some factories that are still humming, but most of them are just kind of abandoned.
The restaurant industry right now is one of the largest and fastest growing industries in America. And yet it continues to be the absolute lowest paying employer in the United States.
Barely anybody's making enough to live.
You're donating plasma to get by.
It's literally a slave wage.
I don't remember growing up like this. My mom didn't have to go to food banks. It's pretty sad.
In times of uncertainty,
Dr. Fauci, it does seem like so much of this we're making it up as we go along.
when you have more questions than answers,
Does flattening mean that we'll soon see a decrease, or does it suggest there's a plateau?
Well, that is a great question.
there's one voice you can turn to for
We
truth,
want to turn now to the important issue of mental health.
understanding,
How do we socially distance without emotionally distancing ourselves?
and making sense of our world.
We are all in this together.
The CBS Evening News with Nora O'Donnell on CBS.
New data suggests a growing outbreak of coronavirus infections among immigrants in U.S. custody. ICE says at least 317 people in its detention facilities have tested positive for COVID-19. A federal judge on Friday ordered the Trump administration release all minors from the facilities after calling them, quote, hotbeds of contagion. Now, other countries are accusing the U.S. of exporting the virus through its deportation policy. CBS News immigration reporter Camilo Montoya Galvez has been following all of this closely, and he joins me now from Kenville, New Jersey. Welcome, Camilo. If you could explain the emerging situation across U.S. immigration detention facilities and how ICE is addressing this coronavirus outbreak.
Good afternoon, Tanya. So at least 317 immigrants in U.S. Immigration and Customs Enforcement custody in detention centers across the country have tested positive for coronavirus. 35 direct ICE employees at detention centers have also tested positive for the virus. The agency, however, is not publicly tracking or disclosing cases among contractors who oversee most of the detention centers the agency uses to detain more than 30,000 immigrants. The agency during the pandemic has released about 700 older immigrants, detainees with medical conditions, and pregnant women, but it has so far resisted calls from advocates and lawyers to oversee a large-scale release of asylum seekers and other detainees who don't pose a threat to the public.
And Camilo, on Friday, as we mentioned earlier, a federal judge ordered the urgent release of minors from immigrant detention facilities. Tell us about the judge's findings and when these minors are likely to be released.
Sure. So this order on Friday is part of the decades-long litigation surrounding something that is called the Flores Settlement Agreement, which is a court settlement that governs the care of children in U.S. immigration custody. Over the years and over Republican and Democratic administration, Judge Dolly G. of the U.S. District Court in Los Angeles has said that the government has violated parts of this agreement. On Friday, she considered the risk detained children face during a pandemic, a global deadly pandemic. The government has released hundreds of children in the past 3 weeks, but Judge G said that greater speed is needed to remove these children from congregate settings where she says they face an increased likelihood of contracting the coronavirus. At least 59 unaccompanied children in the care of the Office of Refugee Resettlement have already tested positive for the coronavirus. Most of them, however, have been removed from medical isolation.
And what is their fate now? Do we know?
Right. So the order by Judge Dolly G on Friday requires both ICE, which detains migrant families with children, and the U.S. Refugee Agency, which cares for unaccompanied migrant children, to properly release them to sponsors who are typically family members here in the U.S. so they can practice social distancing with these families in their communities outside these government facilities. So far, the agency has released, like I said, hundreds of children, but the judge wants these agencies to move at a faster pace.
And Camilo, the Trump administration continues to expel thousands of migrants and asylum seekers, including children, under an order by the Centers for Disease Control and Prevention. You spoke with California Representative Norma Torres about this. She herself is an immigrant from Guatemala and the only Central American member of Congress. So this is, I would imagine, a personal matter for her. Let's listen to the conversation.
Are you concerned about this policy?
Absolutely. That really goes to the heart of American values. We don't deny due process to anyone, not within our country or at the border. I see myself in those children. I too came to the U.S., alone with my uncle. My parents stayed back in Guatemala. My mother was very ill with a heart condition that, my father had to stay there to care for her. So to think that these children are fleeing terrible conditions, and here we are saying, we don't care about those conditions. We don't care about the gangs that you're fleeing. We don't care that you have been raped. We don't care that your parents have been, potentially murdered, or a family member who was taking care of you. We just don't want you here, and we're going to send you back. It's cruel. It's inhumane, and it's something that the entire world has been watching, and it's giving Americans a black eye, not just here in the U.S., but throughout the world.
So, Camilo, tell us a little bit more about how the Trump administration is justifying this. I mean, it is essentially a shutdown of the entire asylum system for immigrants seeking asylum to the U.S., correct?
Sure, this is unprecedented, Tanya. Under this order by the CDC, border officials have been expelling thousands of unauthorized migrants and asylum seekers, including unaccompanied migrant children. This is a seismic shift in U.S. Immigration policy, because unaccompanied migrant children under an anti-trafficking law are supposed to be transferred to the U.S. Refugee Agency after they are encountered by border officials. But now border officials, citing this order by the CDC, are rapidly deporting them to their home countries or to Mexico. And they're doing the same for other immigrants who try to request asylum at the border. Border officials are telling us that this order by the CDC effectively overrides immigration and asylum law, Tanya.
All right. Well, Camilo Montoya Galvez, thank you so much for joining us and telling us all about the latest on your immigration reporting. You do a great job. Thanks again.
Thank you, Tanya.
And we're going to take a quick break now. You're streaming CBSN, CBS News, always on.
If you have COVID-19 right now, what do these potential treatments mean for you?
There is hope, and this drug is hope personified to every person with this disease.
When could this therapeutic drug be available?
The first potential treatment we should be able to know as a scientific community within the next few weeks.
We'll see you right back here tomorrow, because we're all in this together.
To partially reopen today, despite concerns by some it could cause an uptick in the number of people getting sick. At least 12 states plan to soften stay-at-home orders, going against federal guidelines. No state has experienced a 14-day decline in hospitalizations, a pivotal point the CDC recommends before easing social distancing measures. These states join Georgia, South Carolina, and Tennessee, which began allowing some non-essential businesses to open their doors last Friday. Mark Strassman is